Dawn, I
Yes.
believe that I have displayed the document that I think we're talking about.
Yes, sorry, I'm still working on it.
That's okay. If it pleases
Yes,
you,
that
I
is the
would
one that we have for signature.
read the proclamation if you like.
All right, Ed, why don't you go ahead?
Proclamation for the Days of Peace and Nonviolence. Whereas the issue of peace embraces the deepest hopes of all peoples and remains humanity's guiding inspiration, in 1981, the United Nations proclaimed the International Day of Peace be devoted to commemorating and strengthening the ideals of peace, both within and among all nations and peoples. And whereas the United Nations expanded the observance of the International Day of Peace in 2001 to include the call for a day of global ceasefire and nonviolence, and invited all nations and people to honor a cessation of hostilities for the duration of the Day of Peace. And whereas there is growing support within our nation for the observance of the International Day of Peace, including a group of Dubuque area residents inviting all to create a culture of peace by participating in a county-wide celebration from Sunday, September 20th to Sunday, September 27th, focusing on nonviolent conflict resolution. And whereas local and global violence impedes all citizens to work toward converting humanity's noblest aspirations for world peace into a practical reality. It is possible to see our community and world turn from violent to nonviolent solutions within our lifetimes. And whereas the Dubuque Day of Peace Organizing Committee's 2020 focus will be Hope from the Ashes, 75 years after Hiroshima and Nagasaki, with a virtual presentation by Kathy Kelly on Monday, September 21st at 7 p.m. Now, therefore, the Dubuque County Board of Supervisors, on behalf of the staff and citizens of Dubuque County, do hereby recognize the International Day of Peace and proclaim September 20 to 27 as Days of Peace and Nonviolence in Dubuque County, Iowa, and urge residents to further affirm a vision of our world at peace by fostering cooperation between individuals, organizations, and nations. This 21st day of September 2020, Dubuque County Board of Supervisors, David Baker, Ann McDonough, Jay Wickham. Witness thereof by Denise Dolan and attested by Mary Hubble.
Okay, is there a motion to approve the
I will make a motion to
proclamation?
approve.
Motion made and seconded.
Motion to approve the proclamation.
Motion made and seconded to approve the proclamation. Any discussion? All in favor signify by saying aye.
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 Aye. It's carried and approved. Thank you.
Chair Baker, we do have Art Roche here with us, who is one of the individuals on that committee. If we wanted to give him, it's up to my colleagues, a moment to speak, just in recognition of this, the tenacity that it has taken to get this done this morning, and I appreciate everyone being flexible.
Absolutely. Art, if we can get Art unmuted, and we'll happy to hear Art say a few words.
Thank you very much. I do appreciate the extra effort that everyone went through to get this on the agenda today and read so nicely by Ed. Thank you very much. And I'll be very brief. I know you have a big agenda, but this is the 11th year that we have been celebrating the International Day of Peace in Dubuque in the way that we're doing with a speaker and a festival. It's a little more abbreviated because, of course, because of the pandemic. We have all online events except one, which will be the March for Refugee Rights, taking place on Saturday, September 26th. But other than that, everything is online, including tonight. And today happens to be that International Day of Peace that you were reading about in the proclamation. So it's rare that we've been able to actually have the proclamation read on the day of, and we're very happy that that's been the case. And tonight at 7 p.m. is our featured speaker, Kathy Kelly, who will talk about the effects over the last 75 years of that first incidence of nuclear annihilation that occurred in Hiroshima and Nagasaki. So I hope people will tune into that. It'll be on Facebook Live. So you can find it by going to www.facebook.com/DVQ Day of Peace, all one word. And that's our Facebook site. You don't need to be a Facebook member to see it. So we hope that you and all Dubuquers will join us tonight and for the other aspects of our festival, which are also listed at that same web address. And thanks for letting me promote it just a little bit. And that's all I have to say. And I don't know if RRS Stewart is also on the call. She might be. She was another principal person involved.
Okay, thank you, Art.
Okay.
Thank you for all you do.
Sure.
If RRS is on, we'll certainly let her speak as well.
She's probably busy running people to appointments at Crescent Community Health Center. That was what she thought she'd be doing this morning. So, okay,
Yep.
thank you.
I do not see her on the Zoom.
Okay, all right. Thanks again, Art.
Thanks so much, everybody. Goodbye.
Goodbye. Okay, thank you all for making that happen. It was just an inadvertent omission from this agenda. So, okay, we'll move to the agenda. First item up, or next item up would be the work session to discuss COVID-related issues. So we'll go to Patrice Lambert for her report.
Hey, good morning, everyone. I do
Good
need
morning.
to share up front. Good morning. I do need to share up front that Tom Berger nor Stacy Killian are available this morning. I can give their brief reports though as well. I'll start by just telling you our current numbers in Dubuque County. We have had 27,903 individuals tested. Out of that number, we've had 2,773 that have tested positive. Out of that number, we've had 1,883 individuals who have recovered, and unfortunately, we are at 40 deaths in Dubuque County. Our 14-day average for our positivity percentage in Dubuque County right now continues to rise. It's at 14.5%. We are still seeing 49% of our positive cases in that 18 to 40-year-old range. And our next range then is our 41 to 60-year-old. That's a 24%. And with our 0 to 17 aged population, we are seeing 10% right now of positives. Let's see here. Just a few things to share with you. Our vaccine distribution, or our point of distribution, is the main focus right now with our incident management team. We do have to have a plan submitted by October 1st to IDPH, at least a basic plan. We're working with our healthcare providers, and we will be working with our long-term care facilities to see who can actually distribute the COVID vaccine once it is released. IDPH is still informing us that we need to be ready by the 1st of November. They know that it's going to be a limited supply, if any, at that time, that will be released. And then as the months continue on, that will more than likely increase the doses of the vaccine that will be released. So the incident management team is completely focusing on that vaccine distribution plan at this time. We do continue to do our weekly meetings with our isolation shelters, our higher ed population, our pre-K through 12. Stacy and the Visiting Nurse Association actually meets on a daily basis with our school districts. We did have our Dubuque County Healthcare Preparedness Coalition meeting last week. We meet with that group on a quarterly basis. We continue to inform people about the free testing options that are available in Dubuque County, that being with Test Iowa, Hardig's, and Union Pacific. Hardig's did inform us that they have already administered 1,500 free tests, and it looks as though they have gotten the green light to continue their testing through November. And I believe they were going to be doing some type of a press release on that. So we're very thankful for Hardig's, as well as Union Pharmacy, as well as with our Test Iowa with Kelly McMahon. We continue to get numerous calls, whether they be concerns or questions, anything and everything that's related to COVID, which we really appreciate. We do have the Visiting Nurse Association that continues to field those calls 7 days a week, and their number now is up to 18,426 calls. We would much rather have people ask us, the incident management team, those questions and concerns. We do know that there's still a lot of misinformation that's going on social media, and just even in conversations. You know, they'll may hear from their neighbor who heard from a relative, whomever. So we really appreciate people checking it out, checking out basically all information from reliable sources. And basically our other priority, besides with our vaccine distribution plan, is looking at our increased positivity cases that we do have going on right now in Dubuque County. Tom Berger actually is on his way to Cedar Rapids to pick up another 30-day supply of our PPE. And we just continuously tell people, because we have no mandates at all, until we have a widely administered and effective vaccine, that face coverings and social distancing are critical in slowing the spread of this virus. We know we can basically reinforce that over and over and over, and it's based on, the national and international infectious disease experts, but some people are going to completely ignore this advice. And again, we don't have a mandate. All we can do is educate. Again, public health is in the preventive mode. We're not in a reactive mode. So we do everything that we can do to prevent something from happening. And I will be honest, it is frustrating for us that some people just disregard the recommendations. So all we can do is just encourage people, again, not to be listening to false information, not to be putting things on social media that are not true. Again, checking those sources of information to make sure that they are credible sources. And again, we just encourage people to call the VNA call center if they have any questions at all. I believe our hospitalization rate was posted, and it was the same as over the weekend, and we did not have any changes. I think it was at 20 on Friday and Saturday, and that was the latest data that we had posted on the COVID dashboard. Pretty much, we're just, again, telling people, if they indeed are, if they're displaying symptoms of COVID, or if they truly believe that they've been in close contact within 6 feet of an infected person for at least 15 minutes with someone who was positive with COVID, we're just asking people to get tested. Call their healthcare provider per phone, or again, go to one of the free sites that we do have in place. The Iowa Department of Public Health is still doing our contact tracing for us. However, the Visiting Nurse Association with Stacy and the communicable disease nurses, we are doing that additional contact. So we are continuing to push for people, even if you have a number that rings on your phone that you don't recognize, please pick it up, because it might be IDPH and it might be the Visiting Nurse Association. Stacy and her staff, again, go through any questions or concerns that people have by being diagnosed, with a positive result. And the instant management team is just here to help those individuals with that isolation and the quarantine recommendations, because we want everyone to be safe. So that's pretty much all of our Stacy, Tom, and my report all rolled into one. So any questions?
Okay. Do we have any questions for Patrice?
This is Supervisor Wickham. Patrice, thank you for the update and the work. Basic question, but probably a tough one. Why are our numbers going up? Why is the positivity rate going up? Why is the whole number of those that are testing positive for COVID-19 going up rapidly in Dubuque County?
Well, that is a good question, Supervisor Wickham. And what we are basing that on is that with the nice weather that we have, we're seeing a lot of large gatherings outside and events. We're seeing tractor pulls, we're seeing ATV rallies, we're seeing car shows, we're seeing weddings. Again, you know, we are encouraging people to follow the face covering and the social distancing. But a lot of places, again, you know, not whatever, nothing's mandated. So all we can do is base our recommendations as loudly as we can do. And, you know, again, we say it's the best way to prevent any type of transmission from occurring. But we're also seeing that the colleges are still doing a lot of the athletic testing, and that might be contributed to the increased testing with the increased positive rates. But again, with the nice weather, we do have many, many, many events going on, especially through the weekend throughout the county.
Okay, thank you.
You're welcome.
Patrice, Supervisor McDonough, did you get a response back from IDPH about the question I had about the underreporting of long-term care testing?
I did not. And I did send it, but I did not get a
Thank you.
response back.
Thank you. Can you think of any other way on the dashboard? Those long-term care tests they're coming in groups of, I would assume they're 400 tests at a time. Many long-term care centers doing the testing throughout our community required by the federal law. So are they in an antigen spreadsheet? I mean, what other way might they be hidden? Well, let's just rephrase that. Disclose that we're not aware about.
Disclose what? I'm sorry?
Disclosed in a way we're just not alert to.
Yeah. And I don't even want to answer that until IDPH responds, because I don't know, Ann.
Okay. I know that in our shelter currently we have college students. So there's definitely college student numbers for athletes in our positive rate. I continue to be very suspicious of the reported numbers of tests, which would make the positivity rate impossible to determine. And the state is making that number based on information they won't share with us. So I guess I'd also use this time in visiting with you to ask for your recommendation for the release of the numbers that can be shown by zip code or deviation between the city of Dubuque and the remainder of the county. What is your personal feeling about that? When might that information become available?
That is on for the Board of Health agenda Wednesday evening. And we did hear from CJ, which we will share that information with the Board of Health on Monday. But CJ is basically telling us that we just need to have our double checking in place to make certain that no confidential information is being disclosed. So again, that will be voted by the Board of Health, whether they want to have that information displayed per zip code or not on Wednesday evening. We do know that if it is approved, it is going to take some work on our part to filter out all of that information. So if it's approved Wednesday evening, I don't know if we'll be able to release it Thursday morning, but we will attempt in our quickest mode to get that information out if it is indeed approved.
Do you need assistance? Do you need a tech person to be placed on your committee to help you do that? That's something we could accomplish.
Well, with the new state program that's coming out, which is the DOMO, we're hoping that that will already be available for us. We are going to have an in-service on that DOMO. I believe it's Wednesday during the day sometime. So I will have more information to share with the Board of Health Wednesday evening at the Board of Health information. But if we do, I will certainly bring that up. Thank you.
Will you have a recommendation as the Director of Public Health? Will you have a recommendation to the board about the release of the zip code information?
Probably, yes.
And what would that be?
Well, my personal feeling is, but again, I will go with what the Board of Health decides. But I think it would be very good information to share. I think the people in the county will appreciate, or maybe not even appreciate, I shouldn't say appreciate, but I believe that they will possibly will appreciate being informed of the numbers that are going on in their towns.
Well, they have
And,
indicated
you know,
to
again,
me, right, repeatedly, they would like that information.
good. And I'm hoping that with the numbers, if they are indeed released, that when the incident management team again is recommending the face shields, the social distancing, that it will have a larger impact on thinking through those mitigation strategies when they do see numbers throughout the county.
My last question to you, Patrice, is about the large gatherings that we see around the city and out in the county. Certainly there's a tractor pull that was yesterday in New Vienna, and there's an apple orchard having its apple festival next weekend. What is the Board of Health, and what are you asking the Board of Health to do about those events? Are we out there doing any kind of marketing, any writing letters? What role should the Board of Health have? And again, I offer people who might be able to be of assistance if you need extra folks.
I can't speak on behalf of the Board of Health because we would have probably, 9 different opinions, but I can speak on behalf of myself. We are trying to get as many creative messages out to the public that we can, but basically it is all dealing with our mitigation strategies. We have had different towns that have reached out, as well as some events that are being planned that have reached out to the incident management team, showing us what their plan, what they're planning on doing, and then asking for our input. And we do always review and we always respond when people do reach out to us. I know that we are really stressing, again, just following those mitigation strategies. They are so simple to follow, but so vitally important to reduce the transmission of the COVID. If people are wanting, any ideas for posters or whatever that they can be displaying throughout their event, we will gladly help them any way that we can to educate the public while they're there, or even ahead of time.
But you're not doing anything proactively reaching out to events or groups in advance of their actual activity. You're waiting for them to come to you. Is that the current position?
Pretty much, yes, it is. Because we do not have the time to go out to the whole entire county to find out what their events that they're planning are going on. I do know that if they have to request for a permit, we are trying to educate them, as I believe Dawn had some guidance, and I don't know if that's even, happening, but with our mass gatherings, that we are attempting to give at least the CDC link to those those people who are requesting a permit, to at least be knowledgeable of what the guidelines are. But again, without a mandate in place, all we can really do is recommend and highly encourage.
Couldn't we also hire someone to do that marketing piece for you, to do that proactive arm, so that someone is following the large gatherings? Wouldn't that also be a possibility of something to be proactive that might be effective?
If we had, I don't know if even law enforcement could, I seriously don't even know if any citations could be given with any of our recommendations, because they're not mandates.
Right.
That would
And
be something that I would.
I'm not talking.
sorry? Hello?
Can find some.
Oh.
Are you back with us, Patrice?
Yes, I am.
Sounds like maybe my internet's unstable again, but
Yeah.
the point is, we could hire people to do marketing, to do that work. If you think it's important to reach out, we could help you with that.
Let me think of a plan, Supervisor McDonough, and then I can share it with the Board of Health on Wednesday evening. Because instead of me just responding, yes, that would be great, but not having, my rationale for saying, yes, it would be great, I would just ask that if I can have some time to think through this, and then I'll present it to the Board of Health on Wednesday.
Well, I mean, I have created marketing posters, and they have been delivered to several of the small communities, and they're asking for more. So, that conversation is beginning. It would be nice if the Board of Health was in that conversation too, and maybe that will happen.
Thank you.
Any other questions for Patrice?
None for me.
All right. Thank you, Patrice.
You're welcome.
Okay, we will move to our next item on the agenda, which is the Sunnycrest Administrator update. So with that, we'll go to Chris Kirsch from Sunnycrest Manor, our administrator.
Good morning, everybody.
Good morning, Chris.
Good morning.
So I'm going to kind of go backwards with my report. I'm going to refer back to Supervisor McDonough's questions about the long-term care reporting. So IDPH has given us a spreadsheet that if we use the antigen machine, we have 48 hours after testing to complete that spreadsheet. And then we send it to IDPH. After they're done with it, they send it to the state hygienic lab for statistical purposes. So that's where the delay is coming from the nursing homes. Now that spreadsheet is only used if we use our antigen machine. Now some nursing homes don't have the supplies anymore to do their antigen machine, so they're using private labs that they've hired. If they are in an outbreak, and CMS has identified an outbreak as one positive staff person or one positive resident, we can use the state hygienic lab, which then we don't have to fill out that spreadsheet, and the statistics come right from the state hygienic lab. So those statistics from the nursing home are immediate. So a lot of the nursing homes are using the state hygienic lab, as we've all been told, because they are running almost to capacity. Their capacity is 5,000 and they're running at about 4,000 right now tests per day. So, but CMS has made that stipulation that that's considered an outbreak. So, so that may be where some of the delay is coming from those spreadsheets with the
Right.
antigen machines.
You know, Chris, when you do your reporting and you send in, I'm assuming you send in, what, 300 completed tests at a time? The reports on 300, 400? How big might the number be of completed tests leaving Sunnycrest?
About 270. Yep,
270 twice a week?
270 twice a week. If I use the antigen machine.
Right, but whatever testing source we use, those numbers would be reported by you in one communication, right? It would
Correct.
go one time, yeah.
Correct.
And then wouldn't you expect to see that then in the daily numbers that the TH and that the state releases in the next day or so? Shouldn't we see a bigger bump because there's been another 270 tests included?
Well, at least 2 days later, because it has to go through IDPH first, and then it moves on to the state hygienic lab for statistics.
Right. So there should be some big swatches of case numbers coming in if they're reporting that
Correct.
are hundreds, 300 at a time. And you're saying that the other long-term care centers, they should be doing this as well. They're under those same regulations.
Well, correct. They are under the same regulations. They may or may not be using an antigen machine, but they would be using either the antigen machine or a private lab,
Right.
or the hygienic. I've seen the numbers for Dubuque County, and with 11 licensed nursing homes, you would think our county numbers would be higher.
Like how high, how much higher?
I don't know how many. I don't know what the
Well,
facility numbers are.
Right. They have to test everybody who's on their staff as well. Those guidelines are in place for everybody. So
Correct.
Stonehill would be testing 400 people. They'd be reporting them in some kind of block. And we have 11 facilities like that. So potentially there's thousands of tests that are
Correct.
not being counted in the determination of tests completed each day.
Correct. I see what you see. I was just trying to give some information as to why there may be some delay in the report.
Sure. Well, and it's, we've been doing this now a couple of weeks, so the delay we should be finding some batches. I mean, we get back a report one day the state says, oh, there's only been 200 tests done in Dubuque. It's like, well,
Yeah.
wow, that can't be possible. And hey, 40% of those people are positive. Well, then the community's like, we have a 40% positivity rate.
Yeah.
But if it was actually being divided out over a couple thousand tests, we'd still have a high rate, much higher than we would like to see, but we might have a more accurate feeling of whether or not the sky is falling. And, we have people posting numbers on social media with flames around them, showing that, the whole county is on fire with COVID. And maybe that's an opinion that they're wanting to say, but they're pointing to the numbers that the Telegraph Herald's reporting that I know are coming direct from IDPH and are from the dashboard. I'm wondering if there's not a way for, I'll add to your day, Chris, but Ed's sitting there looking for a project. If we couldn't be tabulate, I see you, Ed. If we couldn't be trying to communicate with long-term care centers ourselves to see maybe, should we care? I kind of think so. We should also be concerned about the accuracy of the data. And if we want to contact those folks to see, maybe do our own little testing. I don't know if Supervisor Wickham's up for this, doing his own charts to try to track how many they are not showing the public.
Yeah.
Questions? Yes, Ed's got his hand raised.
I just don't know how they can't not show it. I don't know. I don't know how they can pick Dubuque County out and say, oh, we're not going to show it.
No, I think it's not being showed statewide. For some reason, they have decided that they don't need to report people who are retested 10, 11.
Oh, yeah, that's probably
20
true.
times.
'Cause
Right. They depopulate their numbers
Yeah.
before they put them
Yeah.
on the dashboard.
Because I've been tested 10 times at least, you know, so.
Jay, we didn't hear you before when you were speaking.
Yeah, I'm here now. So yes, I would be an advocate for more testing. I think it gives us a better snapshot at the current moment related to positivity rates, related to whole numbers of those infected. I would encourage those to listen to the Board of Health and listen to our medical providers. And then obviously the whole number of people that are infected with COVID-19 is a concern. And so those positives are going up, regardless of the rate or percentage. The whole number is going up, and that is not the direction we want to go. And so while there may be talk or conversation related to the positivity rates, and that's interesting and can give you, a snapshot of the direction you're heading, the whole number of positivity of those citizens of Dubuque County and Grant County and surrounding areas is continuing to go up. And that is the focus that we want to focus on, to get that down to where we were when we had maybe 10 a day or 15 a day or even less. And so that would be my encouragement to the board and those involved, is that's where you want to focus on, not the minutia of all the percentages and the testing criteria.
If I might, Jay, I'm going to explain to you why I think this is a big issue that's not being reported. I think that citizens are being responsive to a very high, a 30% positivity rate, for instance. And when I take that information and I go to New Vienna City Hall, and they say, well, I mean, that would mean that there'd be, a third of the people walking around New Vienna positive. That doesn't make any sense at all to them. And so there's the numbers not being accurate create this disconnect and this reason to not want to take action. That's one of the reasons people don't want to mask up, is because they don't believe the numbers are accurate. So if we are fighting for accuracy, and then the other thing would be that, if citizens understood really how many tests are being done, we need to have even more testing done. We're doing no testing out in the Dyersville area. Those folks have to travel to Test Iowa clinics. And there's been a request for testing in that community, but that's being stalled at the state level, that Test Iowa is not allowed to do that. So to get our numbers down, we actually need to get our testing up and get our testing transparent. Those things are necessary to encourage more people to be tested for the asymptomatic carriers. I mean, that's what we're finding at Sunnycrest. So many people are positive because they're asymptomatic. And that's going to be happening, county-wide. So that's how I see that connecting.
Okay. No, I appreciate that. I appreciate that understanding and your vantage point. I think I'd go back to my statements from last week. We need testing that is convenient, responsive, and mobile. That's what we were doing in July, and we're no longer doing that. It's less convenient, it's less responsive, and it's not mobile. And so I agree, we need to get back to that level, but casting doubt on the accuracy of the testing doesn't help us. And so I was very discouraged last week when we were talking about that, and then we ended up, the conversation we had a death. We don't want to wait for a death to then say, oh yeah, I guess it was a positive. And so, going back to the whole numbers is critical, and the whole numbers of people hospitalized is another thing that we should be looking at, and then providing more testing. The testing is going to continue to evolve as we're all, witness of. So there'll be different techniques, different technology coming in, but the whole numbers are going up, and that is what we should be, communicating to the public, is that we're heading in the wrong direction related to the spread of COVID-19 in Dubuque County and surrounding areas.
Okay, thank you. All right. Any other questions or for Chris Kirsch? Or Chris, do you have any other words of wisdom for us today?
I don't. We continue to have our COVID unit active. We have 4 in our level 2 isolation. Those were roommates of the positive COVID residents. So we wanted to isolate them to keep an eye on them. And we currently have 8 in our COVID unit. All but 1 are asymptomatic. Yeah, it's a low viral load. They've all been negative several times, and all of a sudden popped up with a positive. So, but you got to treat them as positive. We implemented our emergency staffing plan. All identified CNAs from other departments have been utilized. It's been we'll get through it. 10 days.
Okay. Thank you, Chris. Okay, we'll move to emergency management team update. I was contacted by Tom Berger, the manager of our emergency management services. And Tom is busy all day today acquiring PPE and transporting, making sure it gets transported. So he's not available for today, but he is busy. I think he said he's making 4 trips today acquiring PPE. So let's go to our testing update, which is the next item on the agenda, and we'll bring Ed Raber into the loop for this.
Thank you, Supervisor Baker. This is Ed Raber. I understand the exchange that you were just having there regarding testing. I have had conversations with members of the incident management team. I think to how I frame up the issue that Supervisor McDonough was drawing on is that significant testing is going on in Dubuque County, certainly at staff and residents at long-term care facilities. You do not see those because most all of those individuals have been tested previously. As happens at our board meetings, occasionally we have hires at Sunnycrest, and so like those are some new individuals that may or may not have been tested previously, and that's the only time that you would see them. If they had not been tested, become a Sunnycrest employee, and then are tested, then they would show up. Otherwise, my understanding is that they'll only show up again in the state's counts if they happen to have a positive. And so that obscures, as I think Supervisor McDonough and Supervisor Wickham had noted, the overall picture of what's going on with testing. I am hoping to have a late afternoon meeting tomorrow again with the Board of Health's testing committee individuals. I've been in contact with Dr. Conaroo. We've talked last week about the situation with the antigen machine and what that might represent and what it might not. So we're pushing forward with that to try to figure out how we can use that as a tool to potentially reach more individuals that have never been tested, or individuals, of course, that perhaps have been tested but need to be tested again. So, and that may have a barrier to getting to any of the other testing sites. So one thing to note is as additional testing happens, it does not necessarily become reflected in the information that's in the state's dashboard. So in addition to being able to show information about more precisely about where positives are or where testing occurs throughout the county, as we were just discussing, related to zip codes or in the city and not in the city. I think another important piece that I believe that Patrice and on behalf of the Board of Health has petitioned the state for is show us the total amount of testing that's going on in addition to just those that are new testings. So it is obviously a complex thing. Even if more testing for some reason were to happen on a particular day, you may or may not ever see that in the data unless there was a positive. So we continue to try to work toward that. And I'm hoping to have an additional team meeting before the Board of Health meeting on Wednesday, Tuesday afternoon. And like Patrice, I am waiting for that response back from the Iowa Department of Public Health and would be available to them to help them with any data needs that they have in terms of parsing out the information that they are allowed to display. I have not seen that data. That's all I have, Supervisor Baker.
Okay. Thank you, Ed. Do we have any questions for Ed Raber?
I do not.
Okay. Next item on the agenda, we'll move to item number 4, which is the Board of Health update. And for this, we go to our chair of the Dubuque County Board of Health, Tom Beschen. So Tom, I'll turn it over to you.
Thank you, Chair Baker. The Board of Health is meeting this Wednesday night. We have a rather full agenda, and I'll give you some of the background of what's going on. The Mask of Wellness advertising campaign, we have reached out to the local mayors, all 21 of them. We have had responses from 3, and they are included in the packet for Wednesday night's meeting. So this is, we will talk about this, and thank you, Supervisor McDonough, for the suggestion, but we have been reaching out to these mayors, and hopefully we can get a better dialogue going. And we're not aware of some of the requests for bulletins and posters. Sam Cloft has done an excellent job of providing some of those, and we can certainly provide those. Another issue that we will be talking about is one that started to surface back in August, around the 22nd. We have received a request from the University of Dubuque to consider funding the administrative costs for Epic Health conducting 669 tests of students at $25 per student. I've spoken with President Jeff Bullock from the University of Dubuque. He's asked that we take this to the Board of Health meeting on Wednesday night and consider his request. And that also is in the packet along with the invoices. Zip code update is one that we will consider again, or we'll consider this Thursday, and based on the recommendations and the, how do I want to put it, clarity of the information, we'll make a recommendation and move forward with that. Personally, I think it's something that should be shared. I think it will give our outlying residents a better feel for what what is going on in their areas. And anecdotally, I've heard that COVID is plenty popular out in the county. So we'll have a chance to look at that data and make a recommendation. And finally, China HIP, the Community Health Needs Assessment and Health Improvement Plan. The Iowa Department of Public Health has offered an option to delay publication of that for 1 year. Our board will consider that in light of what else is going on at this moment. That is what we'll be discussing, and if there are any questions, I'd be happy to answer them.
I have questions about the University of Dubuque request for reimbursement. Is this the only request for reimbursement we have before us?
This is the only request that is before us. There was a request that started to come in between the 22nd and the 26th, but I've heard nothing more from Kelly McMahon on that. What I did hear is that she indicated to the colleges that they would have to discuss it themselves with the Board of Health. The University of Dubuque is the only request we've received.
Did the Board of Health know that they were doing the testing before we received the bill?
The request came in on the 26th of August, and that was the day we considered the mask mandate. At the very end of that day, we had word that Kelly was going on campus on the 27th to conduct the testing. We wondered at that point where the funding was coming from, so we did not fully understand it, no.
Did we arrange it or facilitate it as a county Board of Health or a county health department?
We did not.
So if we approve this, it's likely that all of the schools and the schools of higher education could seek reimbursement for testing.
I would assume that's the case, Ann.
I would hope that the board would consider that when you look at, approving this to send on to us, because of course that would be something that I would be considering.
Thank you.
Do you know on Wednesday, are you going to discuss a marketing strategy in the cities?
That is part of the discussion on the advertising, yes. I don't know, I don't fully understand what you mean by marketing strategy in the cities.
Well, taking the Mask of Wellness message out to the small communities. I guess we could call that outreach.
That is the purpose of the discussion, to determine what kind of outreach we use to keep the Mask of Wellness message in front of the outlying communities.
And if you would please tell the folks on the board that I am offering to continue to do that and would do that willingly. There was a subcommittee established for that purpose. I would join with them to continue to do the things I've been doing, with some good response.
Yes, I will.
Thank you.
Tom, this is Supervisor Wickham. Do you, if you could also just remind the Board of Health and possibly the supervisors, I believe is the number that we have budgeted for local testing at $150,000 for this year?
That's my recollection, Supervisor Wickham, yes.
Okay, thank you.
I wonder, is it something you can approve without us also approving?
My understanding, Supervisor McDonough, is that that is money that was allocated to the Board of Health, and it is the Board of Health that decides if that's an appropriate expenditure.
Not to be argumentative, I would be real interested in having clarity from the county attorney related to that, just because I don't know. My general understanding, as we do many of the departments and certainly elected officials, once those funds are appropriated, it goes back to those entities to actually, execute that plan and go forth with those expenditures. But might be good to get, an opinion related to the Board of Health, specifically from our county attorney, if you'd be so inclined to help us out on that.
I will reach out to CJ. Thank you.
Thank you.
Okay, do we have other questions for Chair Tom Beschen, or Tom, do you have anything else?
Actually, this is Supervisor McDonough. I have a follow-up. I'm being bounced off. My internet's unstable, so I'm back on the phone. My question, and Jay, maybe you got an answer to this. I'm sorry, I couldn't hear it. But are the supervisors bound to the expenditure of funds? If the Board of Health on Wednesday spends $16,000 to reimburse the University of Dubuque, and then they choose to do that for other institutions, do we have any control over that, or is that just 9 volunteers doing that?
That was my question to Tom and to CJ May, county attorney. I know we sign claims, and I know that generally we're responsible for the overall budget during appropriation. And these funds were appropriated. They were approved by the Board of Supervisors and included in the budget for this fiscal year. The exact ability now to spend those, I believe the Board of Health and/or departments, elected officials have those abilities, but that was my question as well to the county attorney. And Tom said he was going to follow up with that.
Right. But we also, I'm assuming, would have the ability to convene and have a budget amendment to reduce the amount of money to be spent for testing, if this is how the testing money would be spent, and we would disagree with that.
My understanding is, yeah, we can amend the budget. We do that, 3 to 6 times each year, and the ability to increase and decrease budget line items is generally common.
Right.
Not necessarily this specific area related to testing. We've never done this, but yeah, the Board of Supervisors has the ability to control the budget.
And I would be likely to, just so it's transparent, I would be likely to do that if we're going to have a policy of reimbursing individuals for testing expenses that we were not consulted about the creation of the claim. They took on debt, and we weren't involved in that. So that would be some bad policy.
And I would kind of take the other side of that coin. We've appropriated funds for local testing. I'm not real anxious to wait for the next pandemic to expend those funds. And if these are members of the community, I would be, very pleased that we're able to use county taxpayer dollars to do testing for COVID-19 in an effort to keep people more aware of the spread and to potentially, obviously, risk of the spread through contract tracing, all that good stuff.
Right, but we would need to be informed and aware that we would be paying for it before we would be just reimbursing folks who've taken on debt. I mean, that would be an unusual way to pay for testing, I would think.
Unusual times, I would agree with that statement.
Okay, good conversation. Any other questions for Chair Tom Beschen of the Dubuque Board of Health?
Tom, same argument with the University of Dubuque. Are you going to be seeking information as to whether or not they can afford to do the testing? And what testing are they doing now? Are they going to be submitting claims to us on an ongoing basis? I mean, I would hope that you would have an understanding of what we're, you know, the complete policy that we're looking at with the University of Dubuque.
The Supervisor McDonough, the understanding I have from President Bullock is that he is also interested in ongoing testing, being reimbursed for ongoing testing. So as it stands now, my knowledge says that they plan to continue in this manner and are seeking future funding.
I don't support that based on what we know at this time.
Okay. At this time, we're not taking action on this. We're having discussion. So I would want to get all the information out there before I make a judgment, and let the Board of Health have their discussion. But certainly it would be, I think, wise for groups or organizations to plan ahead and get have approval before they incur expenses. But in so doing, when we appropriated the funds for testing, we want to make that money available for employers and organizations to do testing. So I think there may be a question on timing, but I don't think we're there for that. We don't have a case in front of us yet, but it may be coming. So, Tom, anything else?
No, just that as I told President Bullock that this decision would have to go before the Board of Health, and that will happen on Wednesday night. And from that, we'll find out from CJ whether the Board of Health carries the weight on that decision or whether it then goes to the Board of Supervisors.
Okay, thank you. We do have a comment on chat from Representative Eisenhart. It says, your state legislators have been working with the colleges. There may be some information you are not aware of. So I would ask that we could unmute Representative Eisenhart if he has information available. That's what these meetings are for. Let's get it out there.
I'm actually on two different Zoom meetings at once. Can you hear me?
Yeah, we can hear you.
I'm going to try not to let that interfere. I don't want to preempt a future discussion. I think the Board of Health will be able to cover all the information that's needed and bring it to your attention at a future time. I can just say that Representative James, Senator Yoakum, and I have been meeting with stakeholder groups in recent weeks, particularly the schools as school openings approached. No surprise that the college presidents were somewhat disappointed in the assistance they were getting from the state level. We tried to connect them with additional potential resources at the county level. They were particularly concerned about testing as the students arrived, and tried to work through EPIC and others to put some plans together kind of on short notice. And I think Ed Raber was involved in some of those discussions as well. And so I think you just might want to get that further background information before you jump to conclusions about the meritoriousness of the request from the university.
Okay, thank you, Representative Eisenhart. Any questions for Representative Eisenhart? Okay. Chair Beshin, any other comments or questions on your end?
No, not from here. Thank you, Chair Baker.
Thank you, Tom. Okay, we'll move to the Next item on the agenda, number 5, updates from Dubuque County municipalities. And I will comment on this. We, through Ed Raber, we have sent out a copy of the strong recommendation resolution that the Board of Supervisors did not adopt, but was requested by several mayors. So we have made that available to all of the Dubuque County mayors and many of the city clerks. And my understanding is some of the municipalities are at least discussing that at this time. So, but Ed, I don't know if you have any, Ed Raber, if you have any other comments on that, if you've had any feedback on that.
I have not had any feedback on that yet.
Okay.
Although I do believe that even before we did that, Supervisor Baker, I think few communities had taken that document that they'd actually had previously and have discussed it or done something with it at their own city council meeting. I think Mayor Sandy Gassman is on here. I think that Epworth addressed that.
Actually, this is Supervisor McDonough. I Cascade that took language. The mayor made some firm statements, and it will be in the newspaper, they're hoping, this week at their Monday meeting last week, and reported that to me. I believe Worthington's voting on a recommendation this evening, and I think Sandy Gassman indicated that it's likely to happen this week in Epworth as well. She was going to join us today if there's a way to get her unmuted if she has anything to add.
Just that our city council meeting is Wednesday, and so on Wednesday we will be voting on a strong recommendation, and that's to wear a mask when you can't physical distance. And we're content with the strong recommendation since we don't feel that we could enforce a mandate. So we'll vote on that. I feel comfortable that the council will vote in favor of that. And then we do have some businesses that are willing to post that for us. So.
Thank you, Sandy.
I know that Luxembourg, it was in their minutes that they talked about it and they've tabled it for further discussion. I have been in contact with several of the city clerks, but don't know, there's nothing pending as I understand it right now in Piasta. And every city has, you know, their meetings are scheduled throughout the month and they only meet maybe once a month. So it'll take time, but I'm glad to see that we have at least this time in our meetings where we can invite them to share and also discuss the status in the municipality.
Okay, with that, do we have any other mayors or city clerks in the meeting that would like to give a report?
The city manager of Piasta is here.
Okay. Whitney, would you like to give a report?
I don't actually have a report to give. Sorry, I was just on the phone with the council member. It is on our agenda for discussion tomorrow night. So beyond that, yeah, I know that I'm not really sure what direction they'll want to take it, but it has been prepared and is on the agenda for tomorrow night. So I expect a healthy discussion, and we can certainly let you know how that works out.
Okay, thank you, Whitney. All right, any other of our municipalities? Okay, thank you. Next up, we have work session to discuss supervisor COVID marketing funding. Someone in the lead
Yeah,
on
it would
this?
either be- Dawn, are you,
Yep,
do you have
I'm here.
anything?
Yeah, well, we had, there was discussion at your last meeting regarding the Board of Supervisors' ability to do any type of marketing versus going through the Board of Health with any initiatives. So that you do have that authority to do that. However, you do not have anything budgeted within your own supervisor budget or your supervisor department budget. So this would be an opportunity that if you wanted to partner with some of our smaller municipalities to provide them resources. I know there was talk about posters. And also you as an employer, if you want to take some initiatives as an employer, one thing that has been discussed is putting Mask of Wellness magnets on our vehicles, because our vehicles are out throughout the whole county, showing that support for that initiative as well. So you had allocated money to the public health department, but you do not have any in yours, so you can do that through the amendment, and that would give you an opportunity to have some spending authority for any initiatives or projects that may be requested of you.
Dawn, did you do a survey or have you reached out to see if there's any interest? You know, I did a very informal walkabout with various departments to see if anyone's interested in putting the magnets on their cars. And Sheriff Kennedy said he would only do if it was cool, and it didn't impact, obviously, what the message is that his department's branded with. So, and the roads department had interest, but maybe not on the snow plows. I thought that was also kind and appreciated. But, you know, to put this, if there's going to be any effort to do the magnets of an emoji guy and a short message, to do that, I mean, it's relatively inexpensive, you know, $4 and some a magnet. That would be, it would need to see, you know, who's interested and how that might work in terms of, are we providing, are we offering for sale, which of the county vehicles can carry a magnet. I don't know if you've given that any thought, or where we are on that future process.
So that would be, I am preparing something for next Monday for that discussion, because if this is approved and you're going to provide some funding allocation to the supervisor's department, I will put together a request for that initiative, to fund that initiative with the magnets.
And then as to the posters that have been done, what my husband and I have done, my husband through our company, he's been given the graphics by Lamar through Ed Raver, and he has just recreated it in poster format. So it's the same graphic that is on the billboards around town about the Mask of Wellness. And that has been made into an 11 by 17 poster that's laminated. And I don't have any more left. I've had to reorder. I only did an initial 18, and the city clerks are, and some of the mayors are quite excited to have that. They can find many homes for that to be up, and it just reinforces our Mask of Wellness idea that you wear a mask for the community's wellness. So I'd like to continue to do that and have those available for instance, in New Vienna, the clerk was going to ask some of their businesses to hang them in the front window. So there's marketing to be done, and it's pretty low key. Excuse me, if we want to put, I would say probably even with the magnets, we would be under a $3,000 need to get this accomplished throughout the 20 cities.
And allocating funds to your budget would be able to, it would give us some flexibility. You would be a little more agile in being able to respond to those requests. If some, municipalities are asking for posters, we would be able to respond much quicker because we now would have the funding.
I'd be interested to know what my peers think. What are my colleagues, Wickham and Baker, thinking?
I will, this Supervisor Baker, I certainly willing to look at that. I think it sounds like a good idea. So if the idea of this being on the agenda is to develop a consensus so that we can, move forward in a more formal manner for that, I'm fine with that. I would like to see some detail on, how many, what we're buying and what we're approving the money for and what the, not to exceed would be. But the idea of providing more information and marketing, if you will, regarding the voluntary wearing of masks, I support that.
Yeah, certainly as far as the message, we've had the message of Mask of Wellness and Mask Up Dubuque, and I know Supervisor Baker and myself were part of that campaign with the other elected officials. And so, yeah, fully support getting that message out. Not sure if the magnets on the vehicles are the best way to do that, but, two things. One, I'd like to know the request from the cities. And so last week, I think we were talking about a request potentially for PPE. I'd be very interested in actually getting masks to many people and have them wear them versus just the message. But secondly, if the message needs to come first, I just would need to know what the request is. If this is specifically for our smaller communities, what are they requesting? And then what's our plan to deliver it?
Well, they're not requesting anything until they know we have something. So by showing them what we have, I think I'm creating their interest, and they are requesting more of what we have. I did also drive around with the disposable masks that we have, a good portion of those, and left packages at city halls and talked about, making them available for special events, and that they have enough quantity that if there's something coming up, like we were attempting to target the tractor pull in New Vienna yesterday, so that they could be there and be offered. I know the signs were to be posted in prominent places about, wash your hands, wear a mask. So I think some of this is to say we need to create some ideas. And obviously, I don't think we jump into thousands of pieces of anything, but the reception's been very good, and the interest of having more of the pieces that have been done so far is high. And those masks are out there too. I've got to say though that I think New Vienna maybe took 200 total, and then they took a box for Luxembourg. I mean, I think the message is that they're available. What would you need? This is how they might be used. Is a good reason to just this morning reporting with Cascade City Hall. And they have interest. I wasn't there last week, but they have interest in the materials and in having masks on hand. So I think that's how we begin, and then they can say we have these available from the supervisors, and if the Board of Health is going to join in, it would be from them as well, I guess, if they want. But just to create the offer, and I think everyone has accepted more than I would have anticipated at this point. So it could be the beginning of a relationship that is marketing in that way as well.
Okay, to me, it sounds like we have a consensus to get a more formal proposal on this. And obviously, this is a work session to discuss supervisor COVID marketing funding. So if we want to move that to the next level, next time we meet, would have be on there as a possible action item. And obviously we would need more specifics. So sounds like we do have a consensus.
Yeah, and maybe the last point is that, the Board of Health has already done this once. The city of Dubuque's been very active with it as well. So maybe we can learn from both those entities on what they've sent out, their message, and how well it was received, and what was the best way to get that message. So we don't have to necessarily originate every new idea, because this has been going on for the last 3 months, if not longer.
Okay. Anything else under Supervisor COVID marketing funding? All right.
Thank you for your input.
Thank you. Thank you, Supervisors McDonough and Wickham also. All right. My understanding, we do have some time-specific meetings or work sessions, but that we are allowed for the ones that are not time-specific to move forward. So at this time, we're going to jump to item D, public hearing, UTV ATV ordinance amendment. And this is a, excuse me. Yeah, this is a public hearing. So I think we'll have Dawn, if you want to give the update, or I think it's fairly simple. The proposal here is to eliminate item 16 from the list of roads that are off limits in the ordinance that was provided in our packet. And so I guess open for discussion for the supervisors for that, and then we'll go into public hearing.
I'll make a motion to approve the notice of public hearing.
I will second that.
Okay, there's a motion made and seconded to approve the notice of public hearing. All in favor signify by saying aye.
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 Okay.
Anybody know what page that is on? I'm trying to find it again in our large
It's on the
document.
second page of the agenda.
Done.
Oh, really?
The notice of public hearing.
269, thank you.
69.
Oh, 69, okay, thank you.
Okay, it's up on our screen. Amendment to Dubuque County Code of Ordinances, Chapter 28, Use of All Terrain and Off-Road Utility Vehicles. Amend as follows. Strike number 16 of Addendum A, Sundown Road, south of Old Highway Road to Piasta city limits. So it's actually on the north side of Piasta. And it was, we kept it off limits at the request of the mayor at the time, the mayor of Piasta, because Piasta did not have an ordinance, and the mayor thought that it could cause confusion. So we included it. Now Piasta has passed their ordinance, and they're requesting that little strip of road, I'm going to say it's probably a half mile or less, be opened up. So that's really what we're dealing with here.
Right, and Sheriff Kennedy signed off and indicated that he thought this meeting, the public hearing, would be after the 12:45 work session. So he signed off and said, when we get to this, to call him back. I think they did a brief investigation of the ride that was last Sunday. That was 270 machines without any permit riding through the county. They didn't have a permit for the ride, and there were numerous violations of the ordinance. So I think it's important to have him maybe address that, and we certainly need to be aware of what occurred, because we're talking about, making a change to the ordinance that's in a trial phase. And we certainly had a big a big mistake.
Okay, can we try to get a hold of Sheriff Kennedy, please?
Maybe a point of clarification. Is this actually a public hearing that we're going to open as well?
Well, we haven't opened it yet,
Yes.
but it is, yes, it will be a public hearing.
Did you want to open it now, Jay?
I'm just reading. The documentation is just a little different than we normally have on our agenda. But yeah, I would think we'd want to open it sooner rather than later.
Okay, is there a motion to open the public hearing?
So moved.
So moved. Second.
Okay, I heard a motion and a second to open the public hearing. All in favor signify by saying aye.
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 Aye. Okay, carried 3-0. Public hearing is open. I already said what I needed to say, or what I believe I needed to say, so we're open for public comment.
I think maybe hearing from Whitney would be helpful, the city of Piasta administrator again.
Okay, and we have notification from Shane Backenstead that Sheriff Kennedy will be on shortly. But if Whitney wants to comment and verify that they have requested this change. If she's still on. She is on. Can we unmute Whitney Bathke?
We can't force them to be unmuted. I'm texting her. She may be still on the call, but have turned her attention momentarily to something else. I'm texting.
Okay. All right.
That's *6, or they can do it with the
Okay.
functions in Zoom.
Okay. Is there anyone else that would like to comment while we're waiting on Whitney?
Hey, this is Joe. Sorry, Shane just called me on the radio, said you guys were looking for me on this. Do you have questions or?
Joe, we're in public hearing on the minor modification to the ATV ordinance. The city of Piasta has requested that we open up that short section of Sundown Road between Old Highway Road into the north part of the Piasta city limits. As I explained, the previous mayor had indicated that he would like that off limits because Piasta did not have an ordinance. But since then, the city council and of Piasta has passed an ordinance, and they've asked that we lift the restrictions on that short stretch of road. So that's what we're dealing with today, but it's a public hearing, so
Right. And I mentioned that there was a ride a week ago that was not permitted, that it ended up with 270 machines driving county roads without a permit. And I didn't know if you had, you and I have exchanged some words about that, but I didn't know if there was anything you wanted to address generally about the ordinance, or whether you felt that had any impact on making further changes.
Well, we are looking into the issue from the ride last week. Obviously, it's pretty concerning to us when we have an ordinance that has a sunset clause and is in a basically a temporary state of approval, and you have people flaunting the wording of that ordinance and not following proper procedure and getting permits like everyone else is required to get if they want a ride like that through the county. it's also concerning that as we look into it, that there were out-of-state riders who, after speaking to the county recorder, doesn't appear that the out-of-state riders got the out-of-state riders permits like they were supposed to as well. So, you know, from a law enforcement standpoint, we didn't even know this ride was happening until it was posted on Facebook. You know, it's pretty concerning to us when we have people that are, like I said, you have an ordinance that is in a temporary state of approval and flaunting and thumbing their nose at the wording of that document, which some of those people that were involved in that ride probably had a hand in writing.
That is some of the same concern that I have expressed, and I've expressed that on Facebook and in discussions with the Dubuque Alliance and with the NEAT Club, that there were many folks who commented to me. I was out in that area myself, for heaven's sakes, saw this all go by, and you know, it was an attempt to just completely thwart the rules. And it's kind of put in the phrase that, well, it was for the kids, it was for charity, and then yesterday had a conversation with a property owner who said, well, because it's for charity, they don't need permits. So I asked him to reread the ordinance. I am not interested in standing in people's way on this ordinance. The mayors have reported to me up until this time they felt things were going fairly smoothly. The citizen complaints that have come to me have been from areas that were problems before and remain problems. But overall, the mayors feel that it's worked fairly well and that there's been very few incidents of a trial ordinance right up until this big event, huge error in judgment. So if this is a one and done, with you know, a 280 person ride, that's different than if this is the first of the unpermitted, not regarded, you know, in disregard of the ordinance ride this fall even. We could have a very different situation on our hands. So I think it's important to the public hearing. I appreciate you, Sheriff Kennedy, being here for us and being aware, because this is a time when things need to be right because it's a trial run.
Well, and I think it's good that you brought up the groups that were proponents of this ordinance. I would honestly like to know what they have to say about this incident, and you know, if they're okay with this type of behavior, that's very concerning. And especially when they're the ones that worked to get this put into place. You know, whether they had a direct involvement with the organization of the ride, or it is probably irrelevant. But it'd be nice to hear how the people that organized this and you know, worked hard to get this passed, how they felt about people putting its future in jeopardy through their carelessness or just complete disregard for the wording of that ordinance. And as you stated, there is no exception in there for charity rides. There's no exception for anything. It's the wording is, if you have more than 24 machines in one group, that you will get a special use permit. End of story. So, you know, I don't know if any of them are on today, but I'm really curious to see how they feel about this, and I'd be very concerned about their intent if they thought that this was okay.
Yeah, Sheriff Kennedy. This is Supervisor Baker, and I don't know if I heard about this, and I looked at the Facebook site of the groups, and I know the Alliance group did not participate in this and was basically scolding people because of some of the things that you just said, and he was taking a ration of crap from people who were apparently on the ride. And, you know, so I'm not going to speak for them, but if you would look up UTV ATV Alliance, you can find that on their Facebook page, and I'm sure that those discussions are still on there.
Right, and I had a discussion with that alliance as well, and he posted, they was posted on their website yesterday, on their Facebook page, that there was a board meeting here this morning at 10 o'clock, and also the NEAT Club was invited, and they operate differently. The NEAT Club, they do organized rides that do true all-terrain type vehicles. They're not out driving, you know, dining establishment to dining establishment. They're not, they go places. So, but the NEAT Club was involved in my discussions, as well as I reached out to the gentleman who said he was the host and the person who put together the ride. So I had a conversation with him as well. You know, it's interesting planning when you drive by folks who are counting you, and they're folks that are like, I think Whitney saw it and got caught up in the traffic. And the same with the mayor of the mayor of Epworth, and to some extent myself. So.
Okay, we do have a message from Whitney Batkey from City of Piasta. She's available if we can get her unmuted, or she can unmute herself.
Hello, yes, I'm sorry, I apologize. I've been logged into the meeting, but my phone's been ringing off the hook, so I really apologize. But I had a brief email exchange with Ann. Like she said, personally, I was taking my child to football practice when I ran into the ride, so I didn't have any awareness of it until that moment. But certainly from the perspective of you know, our businesses and the economic impact of the ordinance, you know, I know that weighed pretty heavily on the council, allowing them the opportunity to participate in, you know, can be a pretty attractive option in that Dubuque County tourism. So we, you know, we would obviously like to still take advantage of that. Our businesses weren't a party to this infringement that happened. I would like to think none of my residents were there. Obviously, I don't know that. So my just concern is that addressing that group this way would be, Mommy's on a meeting, might miss the mark a little bit in terms of then the detriment to Piasta's businesses and our community. But I also certainly think that the way that the writers are treating the ordinance and the disrespect is something that absolutely I have no patience for, and we were careful to communicate that very strongly in our ordinance with our community, that will not be tolerated. So I'm just not, again, sure that restricting sundown, which will largely affect Piasta, you know, my concern is that it may not send the message appropriately, while then in effect punishing a different group. So those are just my comments that I would respectfully submit, but I really am, again, in agreement with everything else I'm hearing. I just am not, I can't say that I know what the path forward is.
And I'm not.
Yeah, actually, Whitney, this is Supervisor Baker. We were, you had contacted us about this issue. The issue we're actually dealing with today is opening up Sundown Road north of Piasta to Old Highway, I believe it's less than a half mile. Now,
Yes.
everything is open for discussion. It's a public hearing, but I think we were trying to verify that the city of Piasta has made that request, and I also was contacted by some city council folks to that, along those lines. So,
Yeah, sorry, absolutely didn't mean to get ahead of myself. Yeah, that would absolutely be our request for two reasons, of course. So our residents are able to lawfully and legally get out of town and participate in what the county has provided and opened up, and also so that our businesses can participate with ridership coming into town, and that those riders have the benefit of fuel and food, and something that's certainly an economic perk to our business community here.
okay, thank you.
And just for the record, I understand Piasta's situation, and as long as the restrictions are still in place for Sundown Road south of Piasta, which is where the largest amount of traffic, particularly semi-traffic, is, I'm not necessarily opposed to that section of road being open. That half mile between Old Highway and the north end of the city limits of Piasta. I think that probably, if they have an ordinance that says that people can ride them and they want to take advantage of that, then I don't have an issue with that. My comments were just more general comments about the situation that presented itself last week.
Okay, thank you, Sheriff Kennedy.
Yeah, we're certainly not interested in discussing anything south of town. It's just that half mile you're referencing.
I will share that I did have a city council member ask about Sundown Road South, and I quickly started citing traffic counts, and that's certainly off limits, and is a main connector between 151 and 20, and that we're not likely to entertain that. So,
Whitney, this is Ann. What I would like to point out to you from discussions I've had with folks that organize the ride and the Alliance, they seem to get lost in the mind, that there's things are different. This requires them to do this under this situation, and maybe they feel it's confusing. The ordinance that you have written is even more confusing, because you have times and areas and locations that are unlike any other part of the county in terms of any other city ordinance, because you have to keep people away from your heavy truck traffic. So I'm going to defer to the folks of the Piasta, and I intend to support this, but the reason for the caution and the reason for this conversation to be of the significance of the violations that occurred a week ago on the ride for the kids still stand, and that they cannot flagrantly disregard things and make up their own excuses and exemptions, because they're supposed to be at this point policing each other to keep the rules and follow the rules, and that's been fairly successful up until now.
Yeah, thank you, Ann. And I think that is good feedback. I know that, I guess I would say for the council at this point that I think we would certainly be open to feedback. The way we wrote our ordinance, we will be addressing it 1 year from now, regardless of how it goes. So if there are some clarifications or some language that can be added and removed to streamline things, we would absolutely be willing to, I think they would be willing to consider that. I mean, this was very much trial basis. And I know those times are not convenient, hard to communicate. We're working through that planning now. We just also have a very atypical city design with our 2 arterial roads that kind of tee up to each other. So we tried to address challenges, and we want to maintain the industrial park traffic you know, that's financial lifeblood of the city. So we tried to find a happy medium, and I'm not sure, we won't know yet if that was successful or not, but I think that's something to keep in mind, that we would be happy to consider revisions to the ordinance if that would help it play better with the county's statutes.
Okay, thank you, Whitney. Anyone else like to comment? And again, if you do, please state your name and address if you're a member of the public. We are in public hearing. And you'll have to either raise your hand or contact us on chat. My understanding is they can also, if you're on phone, you can do a *6. Is that correct? I do hear some background noise. I don't know if somebody's trying to talk.
Dave, we did
Maybe
have an
Sheriff Kennedy.
earlier, yeah, his office, I think. We did have an earlier comment left by Tom Gripe in a chat box that he had to sign off and was here for this meeting but had to sign off.
Okay.
It was some time ago.
Okay. Somebody want to read that? I don't know. I must have missed it. So.
I don't have it on mine, but I've signed off and on as my internet keeps expiring here. I don't know if anybody has it. They go back.
This is Ed Raber. Not to read the entire statement, but Mr. Grape left a message that was not in favor of allowing UTVs on county roads because of traffic, carbon emissions, and that it's not a physical activity. So he was expressing his displeasure with the UTV ordinance.
Did he say anything about being opposed to cars, trucks, and motorcycles?
No, he was just addressing the UTV ordinance.
Okay, thank you. Okay, any other comments, written or oral?
This is
I'll
Donna.
make a motion to close the public hearing.
There's a
Make
motion to
close the
public hearing. Is there a second?
I thought I heard someone speaking.
Oh, okay. I'm sorry.
This is Donna. I was just commenting that there's nobody on Zoom indicating they'd like to speak, and there's nobody in the board chambers.
Okay, thank you. All right,
I'll second the motion to close the public hearing.
Motion made and seconded to close the public hearing. All in favor signify by saying aye.
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 Aye. Carried 3-0. Okay, we have the issue of, let's see. I'm looking for a resolution. Is this in the form of a resolution?
Chair Baker, this is Dawn. I have up on the screen, it would, since it's an amendment to the ordinance, it would normally have 3 public hearings. So if you would, if the board so chooses, they can suspend those rules, and then that would be making this effective today. Otherwise, we will have to do 2 more public hearings on this amendment change.
Okay, all right.
Chair Baker, this is Sheriff Kennedy. Are you guys going to need anything else from me? Otherwise, I'm going to log off.
Supervisors Wickham or McDonough, anything else for Sheriff Kennedy?
No, thank you, Sheriff Kennedy.
None for me either.
Nope, thank you, Sheriff Kennedy.
All right, sounds good. Have a good day.
Or you too. Okay. So we've got the amendment to ordinance document up on Zoom.
Chair Baker, this is just like an amendment that you do to the zoning ordinance when Ms. Henry brings you amendments for land. It's the same thing. You go through the same motions. There's no resolution.
Okay.
It's just the motion to approve, to suspend requirements, to have it be adopted and published in the newspaper. It's the exact same motions that you did last week for all of those zoning ordinance amendments.
Yeah, they just look different.
Yeah. Thank you, Denise.
I'll make a motion that the amendment be adopted.
Okay.
I will
there's a
second that.
Motion made and seconded that the amendment be adopted. Any discussion? All in favor signify by saying aye.
Aye.
Aye. Carried 3-0.
And I'll make a motion to suspend the requirement that the amendment be considered and voted on for passage at 2 prior meetings.
I will second that.
Motion made and seconded. Any discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0.
And my final motion is that the, the auditor be directed to arrange for the publication of the amendment in the official county newspapers as required by law.
And I will second that.
Okay, motion made and seconded. All in favor signify by saying aye.
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 Carried 3-0, and the amendment is approved. Okay, I'm going to ask for a very brief recess and of say 5 minutes out of necessity.
I'll make a motion.
Go ahead, Jay.
Motion recess till noon.
Okay,
Second.
motion to recess till noon. All and seconded. All in favor signify by saying aye.
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 Aye. All right, we're on recess. Thank you.
Pippi. Come on, Pippi. Let's go. Come on. Come on. Come on.
Supervisor McDonough, are you online?
Yes, I am.
Okay. Supervisor Baker, are you with us? I know Supervisor Baker was traveling. I'm worried he might have dropped off potentially. Would you want to start? I'm sure he wouldn't object to it since this is kind of a learning work session, and we've got 45 minutes scheduled.
Is there any way somebody can text him and see what's up?
I see Ed looking at that, so why don't you try to do that? So I guess my question still stands if you want to wait.
Yeah. No, what are we at? 7 minutes after? I'm happy to go ahead.
Yeah, I'll go ahead and call the Board of Supervisors into session as the vice chair, and hopefully the Chair Baker does join us, and all is well. He's just a little slow to get back on here. I know we've got the other components on here. Eric Schmeckel, I know I see him on here. If he can get unmuted, and there he is. And so, Eric, I will let you lead this. I know we have some soil and water district employees and/or commissioners on the line as well. So, Eric, you have the floor.
Good deal. Thank you, Supervisor Wickham. Yeah, hopefully Chair Baker can hop back on. So today's 45-minute work session, it kind of going back to the February 14th work session we had during budget session when $390,000 was allocated for conservation-related payments. At that time, the allocation was identified to fund farmers for essentially in-field conservation practices. The topics that were covered were, the no-till payments, cover crop payments. We talked about establishing a buffer program in Dubuque County, and also looked at the prairie strips program. In the last, 6-8 months, after getting the 2080 agreement approved and through, and the creation of a watershed working group, we've been brainstorming with others in the community, farmers and the commissioners, about moving to what I would consider more of a performance-based conservation payment with those dollars, and how we actually spend those dollars, how we implement the program, how we start getting funding out into the hands of farmers to essentially look at improvements in water quality or watersheds. Changing landscape is really what it's about, what these payments are about, that you guys I know are familiar with. Today, Adam Keel is with us. Adam is the Director of Conservation for the Iowa Soybean Association. And momentarily here, I'm going to turn it over to him. I think he has a brief presentation. I have spoke to all three supervisors, as well as the Soil and Water District Commissioners back in a July work session on conservation-based performance or pay for performance type of payments and programs that reside within Iowa, which is relatively new. It's been around in the United States, I think, for a little while now. But the feedback that I've gotten from commissioners as well as others and farmers, and I'm sure Adam is going to talk on this, is going to a conservation type payment system has been very positive. Farmers seem to like it. It's a little more innovative. I think it's a little more flexible in how the payment structure can get worked out from traditional funding sources, such as state and or federal funds that have been established and have been coming into the Soil and Water Conservation District. Adam's going to talk about what's called the Soil and Water Outcome Fund, and that's essentially what it is. You're paying for environmental outcomes. The Soybean Association, one of the big advantages to this program is that it leverages both the carbon sequestration payments or carbon credits for farmers. So you're actually paying maybe a 50-50 mix of both cover crop, no-till type payments, in-field practice payments, ecological service payments, and then it's leveraging those dollars on top of carbon sequestering type payments from investors such as Cargill and so forth. That being said, I think all three supervisors are aware of what the program is or have some identification with it. I'm going to turn it over to Adam Keel and let him continue with his presentation and get into some more of the details.
All right, thanks, Eric. And I think Ed's going to bring up some slides for us to look at as we go through this short presentation. I also want to introduce Mark Lambert. He's on the line as well, and he's my partner on the Soil and Water Outcomes Fund. And we're going to go back and forth with the slides that we've got here today. So you heard from both Mark and myself. To start with, the Soil and Water Outcomes Fund is really a collaboration between two entities. The Iowa Soybean Association, which is a really farmer-focused, Iowa-based entity, and Quantified Ventures, which is a financial firm that focuses on outcomes-based transactions, which is what we're doing here with the Soil and Water Outcomes Fund. So Mark and I will go back and forth. I'll start with this slide, and then Mark will take the next. So thanks, Eric, for leaving it on this slide. The mission of what we're trying to do through the fund is to align stakeholders through an outcomes-based transaction focused on agricultural sustainability. So when you think about the allocation of funds that the supervisors have put aside, nearly $400,000, ultimately the result of that, I believe, is to achieve environmental outcomes, whether that's improved soil health, improved water quality, improved flood resilience. That ultimately is what payers, in your case, the supervisors are put in the payer category. That's what you want, is those environmental outcomes. The agricultural BMPs, such as cover crops and no-till, are a pathway to get to those environmental outcomes that you desire. So we're looking for an easy way for payers like Dubuque County and others to get the outcomes they desire in a low risk way. And that's what the Soil and Water Outcomes Fund does. We leverage private capital on the front end and use that capital to implement and work with farmers on in-field BMPs. And throughout the year, we monitor the performance of those BMPs to understand what kind of outcomes they're producing. At the end of the year, then we aggregate all of those outcomes, whether it be reductions in soil erosion, improvements in water quality, improvements in carbon sequestration, and then we transact with payers at the end of the year after everything has been implemented and verified, and that payment is typically conducted through a services contract or procurement, like what many governments are used to conducting with other business. In our first year, this current year, our partners are Cargill, City of Cedar Rapids, City of Ames. Our validator, which Mark will talk about in a moment, is environmental consultants. And we're also working with USDA on NRCS and NRCS. And really the purpose of what we're doing here is trying to bring together different beneficiaries. And as Eric said, these on-farm conservation practices like cover crops and no-till not only improve water quality, but they improve carbon sequestration. So we're stacking those outcomes together and stacking the payers together. So we've got a graphic on the next slide, Ed, if you want to advance, that focuses on the structure. So Mark, I'll let you talk briefly about the structure that we have set up.
Yeah, thanks Adam, and thanks everybody for the time today. So this transaction structure diagram kind of outlines in a visual way some of the components that Adam described. There's a couple, so I'll step through this quickly, and then there's a couple things I want to point out that make this Soil and Water Outcomes Fund structure particularly unique. So first off, the idea behind this initiative is to use what we refer to in this slide as impact investment, but really private funding, private capital, return-seeking capital that is interested in achieving some form of environmental impact along with its return, using that funding as a source of payment to provide financial incentives to participating farmers in targeted watersheds to implement the conservation practices that Adam mentioned. So cover crops and no-till, for example, and there are a handful of others that we're supporting this year and anticipate supporting going forward. But the idea is to use that impact investment funding routed through the Soil and Water Outcomes Fund, which is that circle there named Revolving Fund, managed by Iowa Soybean Association and Quantified Ventures, provide that funding to participating farmers for practice implementation, and then monitor and verify the resulting ecological or environmental outcomes. And Adam mentioned that on the previous slide. We have a third-party independent consultant, which is based, who are based in West Des Moines, called Sustainable Environmental Consultants. They run a couple of different sort of biogeochemical models for us, one to attribute water quality improvements to those practices and one to attribute carbon sequestration to those practices. So the critical component here being, these practices farmers are implementing are generating multiple environmental outcomes, and those discrete environmental outcomes are measured and monitored. And we're talking here specifically about pounds of nitrogen reduced, pounds of phosphorus reduced, and when we say reduced, to the reduced or avoided from running off into surface waters. So nitrogen and phosphorus, and then tons of carbon sequestered in agricultural soils. So those are our outcomes. Those are what Adam and I would kind of refer to as these ecological or environmental commodities that are produced by more conservation-oriented practices on the farm. Those result from those practices implemented by farmers. And the fund then sells those discrete environmental outcomes, nitrogen, phosphorus, and carbon, to different categories of Adam referred to as payers or beneficiaries. And the key element of this initiative is to bring together multiple different beneficiaries who all desire complementary outcomes together in the same transaction. So specific example, this year, the cities of Cedar Rapids and Ames are purchasing nitrogen and phosphorus reductions from the Soil and Water Outcomes Fund to apply them against NPDES permits or bank them for future use. And Adam can explain a bit more about that. And we're also bringing Cargill to the table, who are purchasing all the carbon reductions from those practices. So those different parties are participating together, effectively subsidizing each other's participation by purchasing just the environmental outcome they're looking for after it's already been verified, rather than paying for the cost of program design or practice implementation. And then the revenue from the sale of those outcomes comes back to the Soil and Water Outcomes Fund, which allows us to repay our investors, but more importantly, scale up that program in subsequent years to a much larger scale. So quite simply, that's generally how this transaction structure works.
Yeah, let's go to the next slide, Ed. Yeah, so this should become apparent here as we kind of walk through a couple different ways of describing the Outcomes Fund. But we have different participants, and I'll focus on a couple that are relevant here for the conversation today. The first, farmers. So farmers' role obviously is to implement best management practices or conservation improvements on in their farm fields. And the way that we work with farmers is not in a prescriptive or a directed way, but really give them the opportunity to define what works best for their farms and for their fields. And we don't have a flat payment structure since we're based really on developing outcomes. The payment to farmers is scaled based on the outcomes that they generate for us. So if a farmer changes one minor thing, the payment is going to be relatively low. If a farmer changes 2 or 3 things that have great ecological benefit, then the payment is going to be higher for them. So we're really structuring that payment to farmers based on the outcomes that they produce. And we have noted in here, it's a new revenue opportunity that's different from the way that farm conservation programs have been delivered in the past. In the past, most have been structured in a pay for practice way. So say, for example, if a farmer implements cover crops, they'd be paid $25 per acre for those cover crops, no matter the outcome. We're flipping that on its head and paying for the outcomes generated, not for the practice. Just want to point that out. The next one I'll point out here is the municipal NPDES permit holders / government line. Obviously, this is where Dubuque County would fit in as a purchaser of outcomes on the back end. And a few points there. This is a way to achieve regulatory compliance. I know that Dubuque County doesn't have that necessarily. When we were talking to Ames and Cedar Rapids and other municipal partners, they do have regulatory compliance, and they're using the fund as a way to achieve that. Also, we know that although we're structuring the payment around nitrogen and phosphorus, there's other benefits that come along with these infield BMPs. Those include flood risk reduction, improved sustainability, and the list goes on with those. This is a way for payers to invest in the watershed by paying for outcomes in a low transaction cost way. And what I mean by that is the fund handles all the recruitment of farmers, it handles all the contracting, all the data collection with farmers, all of the modeling of outcomes. And at the end of the day, we aggregate those outcomes, and that's the determining factor for the outcome payment that we would structure with Dubuque County in this case. But all of the management of the program, recruitment, data management, verification that the practices are occurring, that's all on the fund. So we're absorbing that risk and responsibility, and the payment for the outcomes occurs only after they're produced. And I think one obvious point here, bullet number 4 under that category, is build connections with the non-point source community. This is a way for Dubuque County to show that they're investing with farmers. This isn't a case where the outcomes fund is going to present themselves as the entire face of this. This is really a cooperative effort with Dubuque County. So if that's, making a special note along with the payment to the farmer that this ultimately is coming from the Dubuque County Board of Supervisors, we're more than happy to work with the county to determine what the best approach is to kind of co-brand this and co-message it. Let's move on to the next slide, Ed.
Just a couple points to call out here, although some of these may be kind of implicit or explicit from what we just went through, some of these from these last couple slides. The first bullet here, beyond cost share, what that alludes to is that what this program is intended to really replace, or perhaps supplement at the very least, is existing state or federal programs that are already in place and providing financial incentives to farmers for implementation of conservation practices, of best management practices on the farm. A lot of those programs are pretty restrictive about their eligibility requirements and the types of payments that they make and the practices that you're allowed to implement as a farmer. The intention here is for this program to really provide very significant payments to participating farmers that go in most cases beyond the ability of those existing state or federal programs in terms of the dollars per practice or per acre. And also to remove some of the barriers and bureaucracy around those programs that we feel have limited adoption of some of these practices at scale. So really this amounts to a kind of privately funded alternative to some of those programs, and we think that's necessary and important really to get to the scale at which we're making significant impacts, for example, on the nutrient reduction strategy, on water quality more broadly in the Mississippi. Of course, this is an Iowa-focused project, but also in putting more carbon in the soil. So I think that's the intention of that first bullet. I think the rest of these we've touched a little bit. We're farmer focused, which means really we're asking farmers to come to us with a program. What practices would you like to implement on the farm? We come back to them and let them know what we can pay in terms of the value of the outcomes that are created from those practices. So we're not prescriptive. We're not here to sell farmers any inputs or services other than incentives for implementing conservation practices. And then in terms of the stacking of benefits, I think we mentioned that, carbon and water quality, but there are of course a number of others that we could think about: source water protection, flood mitigation, biodiversity, et cetera. Stacking of these outcomes is really essential to what we're doing here. And then the payment for outcomes. At its simplest, we're creating a pathway for beneficiaries to pay for specific outcomes rather than for the practices that lead to those outcomes, which we think shifts risk and takes some of that performance risk and financial risk off of the table for beneficiaries like Dubuque County. Maybe advance to the next slide here.
Yeah, and some of these on this slide we've talked about already too, but just to point them out, you know, we're scalable depending on the level of outcome purchases our payers desire. We can scale up or down or into new geographies, and that's what we're looking at doing here in Dubuque County. We're flexible, and that's kind of implicit with this whole program, is that farmers, you know, aren't told what to do. We work with them to generate the maximum amount of outcomes from those fields and from the farms. Efficient from a buyer standpoint or a payer standpoint. You know, as I mentioned, we handle all of the contracting, the management, the recruitment. So in terms of how we would work with Dubuque County, it's a simple end of year transaction for outcome purchases. And last focus that we haven't talked about here, or what sets us apart here, is the additionality component, is that we're not paying farmers for things they're already doing. These are improvements that have to be additive to the current baseline of practices on the farm. So if they're already doing cover crops, we can't pay for the outcomes that are associated with that. There would have to be additional practices that the farmers implement on top of what's already taking place on the farm. So let's go to the next slide. So I'm just going to talk a little bit about how we've performed here in 2020 with our work with Cedar Rapids and Ames, and I'll move quickly through these slides so we can get to questions in the last few minutes that we've got. So in 2020, our goal was to pilot this on, actually our initial goal was 6,000 acres, but we quickly surpassed that and ended up with around 9,500 acres of enrollment. And our goal was not to have a large number of acres, but more or less to test out the mechanics of the transaction with farmers. And that's what we did. Worked with 15 farmers upstream of those two communities, and you can see the dots there. The average field size was around 92, and that's probably would be a little bit different in Dubuque County. But our average farmer enrolled 632 acres in the program, and had some farmers enroll their whole farm. You can see there our biggest farm enrolled was 3,000 acres. With our focus on producing outcomes, we're not so much trying to you know, work with the maximum number of farmers possible. And this is something that is important to note. We're focused on generating outcomes. So how we do that may look different than some traditional USDA or state Department of Ag cost share programs, in the sense that we have no acre cap on the enrollment that we accept into the program. So let's go to the next slide. This is where we kind of get into, I think, some of the data. So this is what farmers brought forward of those 9,500 acres last year. And we had just north of 9,000 acres of cover crop, around 4,000 acres of reduced nitrogen rate on the fertilizer. We had additional crops added to the rotation on 2,500 acres. And we had reduced tillage on 7,200 acres. So you can see if you were to add those up, that adds up to way more than the 9,500 acres that we had enrolled. The reason for this is farmers are putting these together and doing multiple things at the same time. So many of the farmers who are doing cover crops also reduce tillage. Some stacked three things together, might be cover crop, reduced N rate, and reduced tillage. So really giving farmers the flexibility and, you know, again, as we said, not looking for a specific practice, but really looking for the outcomes. Farmers really came through and decided to look at multiple practices at the same time. Let's go to the next slide, and I think we actually here get at what the outcomes of that work are. And I'm going to ask you to look here at the kind of the top two lines here, where we look at the total and the average. So our three monetized outcomes this year were carbon sequestration, which is the CO2e column, nitrogen, and phosphorus. So on the carbon side, we reduced just over 7,100 tons of carbon, or put that in the soil from the air. And we reduced over 170,000 pounds of nitrogen, or prevented that from going into rivers and streams, and around over 18,000 pounds of phosphorus per year. You can see there our average per acre, around 3/4 of a ton of carbon, 18 pounds of nitrogen reduction, and 2 pounds of phosphorus. Those are our monetized outcomes that we achieved this year. And it's that top line that will be contracting with our outcome buyers this year. So in the case of the carbon, that'll be purchased by Cargill. The nitrogen phosphorus there will be split between Cedar Rapids and Ames, and we'll be growing that into the future. So I think that's the last slide we've got. If we can advance maybe to the questions slide, we'll leave time for questions. And there's my mugshot. And as I mentioned, Mark is my partner on this, so he'll happily answer questions as well. So I'm sure there are some. So let's open it up and see if supervisors have any questions.
Thank you, Mark. Thank you, Adam. Supervisor McDonough, do you want to lead off with any questions? I have a list, but I'll give you first shot.
I don't have any at this time, so go ahead.
Okay, maybe the high level, thank you for the presentation and the information. I reviewed it in the slide deck, but hearing your words behind it helps. Maybe from a high level, just quickly, when did this fund start and how large is it in dollars?
Yeah, so we've been working on this for about 2 years now, and it started out with some grant funding to do some research into this development, developing this program. We're currently near the end of our pilot phase with the outcomes that I described, and then we're looking to scale up in 2021. So outside of any Dubuque involvement, right now we're looking at around 100,000 acres of impact in 2021. So going from 9,500 acres in 2020 to 100,000 acres in 2021, absent of any Dubuque involvement.
Okay, can you put that in dollars for me, please? Estimated?
Yep, it's around $10.3 million of outcome purchases. And I think that 10.3 is the total from calendar year 21 and 22.
Wonderful. And then just if you know off the top of your head, Ames and Cedar Rapids, you mentioned them. What is their local government involvement in dollars, if you could describe that?
Correct. Both are reasonably near the involvement that we're thinking about here with Dubuque. Cedar Rapids is in for around the $200,000 mark, if that gives you a point of reference. And also I want to make sure that you understand too that a $200,000 investment, say from the city of Cedar Rapids, has a much bigger impact because we're leveraging that with complementary carbon purchasing power from Cargill and other customers that we have on the carbon side. So $1 of municipal investment on the water side advances much more work on the landscape because we're stacking together the carbon and the water. And we really see Dubuque County as a water outcome buyer, and then Mark and I will work to bring in complementary carbon buyers.
Okay, and then let's say that we, for argument's sake, $400,000 into this fund. Is there any additional value add, monetary value add, that would be compounded or added to that, or is it just the benefit of the program that you described?
To Dubuque or to the farmers?
However you'd like to describe it.
Okay. Yeah. So let's look at it from the farmer standpoint first, and then we can expand on it if it doesn't address your question. So again, let's just say we took $400,000 and invested that into outcome purchases via the fund. We would have some amount. It probably would be around $400,000 of complementary carbon purchases from a carbon purchaser TBD. So then the farmers would receive, much more than just the $400,000 from Dubuque. They would receive both the $400,000, but then also the complementary value of the carbon that they produce on their farms and that would come from some other non-Dubuque County source.
Okay, thank you. And then it gives me a little better picture. Any maturity date on this fund? Any expiration date that this group's looking to do? You mentioned a pilot and then ramping up. Any maturity date that you see in the next series of years?
Mark, you want to tackle that one?
Yeah, I think we really view this as a well, ideally, of course, we're in our first year, but we view this as a long-term program. And the term fund is a little bit of a misnomer in the sense that it implies some kind of a wrap-up or sunset. We're really hoping to enter into long-term agreements with our farmers that are participating. You know, we're in annual agreements now because it's the first year, but we'd love to move to 5 to 10 year agreements that are renewable with those participating farmers to continue to incentivize those practices year over year. And similarly with our outcomes customers, to continue to purchase that carbon and water quality benefit over time. We'd really like to match up the duration of those two agreements so that the customer, you know, the sale agreements for those outcomes and the supplier agreements with our farmers are the same duration. So of course we need to do a good job convincing our customers that this is right for them in the long term as well. But the idea is to keep this going, and you know, as long as it's practicable. We have sight to the next 2 years of outcome purchases, as Adam mentioned, but we have intentions to go much longer than that. What does that mean? And nominally, you know, 5 or 10 years at least, if not longer. We're still getting going, but that's the intention.
Okay, thank you. And just a couple more questions. The curiosity's got me. Any of this fund have anything to do with the subsidies from the federal government into the soybean farmers? I think it was over 20 billion nationwide, and Iowa might be at 900 million, say about a year or so ago. Any relationship or connection other than they're the same people that belong to the association?
Nope. And those market facilitation payments didn't go through the association at all. They're directly from the USDA to the farmers. That was more focused on the production side. We're really focused here on the environmental outcome production side. So the farmers would have received market facilitation payments, but our focus here is on the production of the environmental outcomes.
Very good. Last question on the project. You mentioned flexibility. Talk further how Dubuque County, and then specifically, you know, our relationship with the city of Dubuque and the soil and water commissioners, the district, would we have local control of determining those projects? Tell me how that would work.
Yeah, we would work with you to determine what the, you know, your desired outcomes are. We've used nitrogen and phosphorus as a kind of surrogate for water quality outcomes to this point, but we do have the ability to, you know, monetize other outcomes too, if that's a desire of the county. So if you wanted to focus on something like the, you know, reduction of soil erosion and use that as the outcome and assign a value to that, that is possible. So that would be the first thing about flexibility, is we really work to develop what the monetizable outcomes are and then structure the transaction around that. This is really built for municipalities. So Dubuque, the city of Dubuque could benefit from these outcomes that you're generating, and would potentially pay for as a county. So I would just keep that in mind. I don't think the city's quite there yet, but the county could sell these outcomes that you're purchasing from us to the city. They have regulatory value. And although they may not directly to you, because you're kind of doing this through a voluntary approach, I think, is from what I understand, the 400,000 is just the allocation. What you're purchasing from us does have value to someone, and that someone in your case is the city of Dubuque. So how you know, evolve past your potential relationship with the Soil and Water Outcomes Fund and potentially interact with the city, that flexibility is there, and we can work with that. Or if you just want to buy these and hold these outcomes and, you know, transact them at a future date, or not transact them at all with the city or another regulated entity, that's up to you folks. But I just want to make sure that you understand that, you know, in the other use cases that we have in Iowa, these outcomes that are being purchased do have a value that is very attractive for, say, the city of Cedar Rapids and the city of Ames.
All right, I will open up. Thank you very much. I will open up to others. Any other questions or comments that we have? I know we've got a commissioner or two on the line and a few other people. So during this work session, anyone else would like to ask questions or speak?
This is Supervisor McDonough, and I have a question or two for you, Adam. Can you, is this the reason why Cargill, their motivation to participate, is it to buy regulatory credits? Is that what they're doing?
So for Cargill and all of our purchasers on the carbon side, it's not to meet a regulatory requirement. For the carbon side, it's for them to reach what's called their Scope 3 sustainability targets, which is kind of their public goodwill gesture that they're going to reduce their carbon footprint. So there's no regulation saying that they have to do that. It's a nice gesture, and they have company goals that they want to improve sustainability in ag, and this is one of a few different ways that Cargill is accomplishing that company goal, is to purchase carbon reductions from the Soil and Water Outcomes Fund.
Very good. My second question is, one of the goals of the program that we will be working on implementing is to entice or encourage new farmers to adopt practices like cover crops, no-till, and so forth. But in terms of whether or not there'll be some kind of measurable progress or an outcome to base if their cover crops don't succeed because they're new and they've hit barriers, how will this impact them? I mean, they may be they may have great interest in participating, but their outcome's been poor.
Mm-hmm. Yeah, and that's understandable. You know, cover crops can be a challenge for new farmers. What we do, right or wrong, I'll just tell you how we approach this is we use models that rely on the location of the field and the data that the farmers give us about their management. And as Mark said, we use two models, one for carbon and one for water. And those models account for year-to-year variations and kind of predict over the long term what outcomes are going to be generated from those practice changes on the farm. Knowing that there's going to be some years where there's not, you know, below average outcomes, and some years are going to be above average environmental outcomes. But we're trying to average that out and, you know, not necessarily penalize those farmers for things that are perhaps out of their control, but use validated environmental models that have been scientifically accepted and actually produced by USDA to help inform what those outcomes on an average year would be.
Is there anything in this program that aids the new farmer to learning?
Yeah, so one thing that, and this is an area where we could also engage with some of the local SWCD staff and others. One thing that we're going to do is have conservation agronomists on staff to help those farmers through the process of, you know, implementing cover crops or switching to no-till, and they'll have access to our research and our experience of other farmers and expert farmers in the area that we'll be able to connect them with and provide them guidance on. But, you know, really it's the local experts that are potentially a good resource as well. So that'd be a great partnership with the Soil and Water Conservation District to, you know, aid those farmers in getting local advice to them. And we're for sure not opposed to that, and we're not looking to take the place of the Soil and Water Conservation District, but if we can work together and get farmers educated and informed, we're all for that. We want farmers to be successful, just like you want them to be successful when it comes to conservation. So anything and everything we can do there, we're open to that.
So Adam, then would you say that one of your goals is to increase the numbers of farmers who are participating?
We have to, yep. We're not able to take into our program farmers who who are already or we can't pay farmers for things that they're already doing today, right now. So if a farmer came to us who's already doing no-till and cover crops and says, hey, can I participate with the outcomes fund? They would have to do additional conservation on top of what they're already doing in order to participate. So we're only taking in those new practices and the outcomes that are associated with that. That's a principle of ours, and we're going to hold true to that. So yes, if we don't get new practices, we're not successful, and therefore you're not, we're not transacting on outcomes with you if we don't have those new practices and new farmers.
Mm-hmm.
Supervisor Wickham, can I ask you?
Go ahead, Supervisor McDonough.
I was just going to say that would be a reason. I am after people who maybe haven't been successful before and wanting them to try again. And I'm also after continuing working with farmers who have had success with this to be a support and increase their return on investment in the continued production of crop acreage that are using these things. So, excuse me, I think that's one reason why, we wouldn't want to be placing all of our funding into this one type of performance-based conservation with your program necessarily. I favor what you're discussing and I find it very interesting, but I'm probably not all in one direction.
Yeah, I wouldn't say that would be our request either. I think Eric and I have talked about piloting a few different options, and this would be, one of a couple that the supervisors could explore. I wouldn't ask for the whole allocation of what you've looked at. This is probably just a pilot for seeing how it would work with Dubuque County. So I see it as just that is a test run on some set number of outcome purchases that doesn't consume the entire allocation that you have put forward.
Thank you. I enjoyed your presentation. Thank you.
All right, let's go to Mike Freiberger here. I know you got a commissioner online that wants to speak. I think you're unmuted. Mr. Topsoil, yeah. Mike.
Adam, this is Mike. Worked with you quite a bit when you're working at DNR and your GIS. Now, the part of this program that would probably be very beneficial in Dubuque County, being we have pretty steep topography and stuff, is when you're doing that verification, is there a chance that you can have that person do the infiltration test and the actual change in the infiltration in that site, which would benefit the flooding downstream? That would be one impact that I'd be very interested in. Also, the city of Dubuque basically has an MO with DNR for nutrient reduction. So, this is another partner that we could actually jump in with Dubuque. So, yes, I think this program is very good, especially with, knowing your past history with GIS and stuff and looking at the carbon part of it. City of Dubuque has a major emphasis on carbon reduction. So I really like this.
Yeah, it's good to see you again, Mike, too. It's been a number of years. One thing to address your question about the monitoring, the soil infiltration, most definitely. Right now, we have a 10% monitoring requirement. So a random 10% of the fields that are enrolled are subject to in-field soil and water sampling, and that would be the case here. So what we do is go out to those fields and sample them for soil and water conditions. On the soil side, we do total organic carbon as a soil measurement, but it'd be easy enough to add an infiltration test to those 10% of the fields, and that would be an add-on that would have a flooding benefit too. So that's a good thing. Yep.
Okay, another question too is the Haney test is a very important test that people are using for soil health. Is that part of that program too, that they do that? Basically, this would be a good way for the farmers to see some of the results down the road in how their soil is performing for them too.
Yeah, so that's one thing, Mike, that we don't do is the full Haney test. We're trying to limit costs as best we can, and by just doing the total organic carbon soil test, we can save significant dollars on that. You know, we're out sampling a lot of soils, so that was one area that we did cut back and focus only on the carbon aspects of the soil. But something we could look at too, if you want to customize this a bit, we can always do that and add in additional soil test parameters that would provide, you know, more information back to the farmers.
That's all I have, Adam, and good seeing you again.
Yep, thanks, Mike.
Very good. Do we have any other commissioners online? Do you know Mike or Colleen? Don't think so. So I know we're over our time, but I know Mr. Raber wants to get a comment in or a question, and then I'll turn it back to you, Eric.
Thank you, Supervisor Wickham. Quick question, Adam, just to understand the conversation you were having with Supervisor McDonough about new practices. Are you looking for just new acres? So would that be something where a farmer or producer was had some of their acreage in cover crops and they wanted to enroll more? They could do that with you. Would that be a new acres? So a farmer doing some of these existing practices could enroll additional acres in your soil outcome fund, right?
Correct. Yep. Yeah. If say they're farming 500 and they're doing cover crops currently on 100, they could enroll that remaining 400 in our program.
Or whatever number.
Or whatever number. Yep.
Right.
Correct.
Okay. I just wanted to make sure I understood that correctly. Thank you.
Yep.
Thank you, Supervisor Wickham.
You bet. Good discussion here. Eric, we'll turn it back to you. Maybe a wrap up and where we move forward from here.
Yeah, thank you. Thank you, supervisors. Thank you, Adam and Mark. It was a great discussion. So yeah, today's, you know, as you saw in the memo that Ed had drafted up, today's presentation was kind of let Adam and Mark and have the supervisors marinate over, you know, what the Soil and Water Outcome Fund is. 1 week from today, we will hear from one other program that I'm proposing to potentially pilot in Dubuque County with some of the allocated funding, program called True Terra. And you'll hear we're scheduling a work session from 1 week from today with some of the True Terra guys and how that program is going. Again, it's another modeling type conservation sustainability index program for farmers, relatively new, but Adam and I have talked and agree of piloting a few different things in Dubuque County and then looking at this in the next, you know, 1 to 3, 4 years to see what's been working, what hasn't, and so forth. So that will be on the agenda for next week. I also have been in touch with Brian Preston, and we're talking to NRCS a little bit more on potential structural projects for this upcoming year in the allocation as well too. So that we'll be reviewing that as well too as we move forward here in the next couple of weeks. But within the next 2 to 3 weeks, hopefully the allocated $390,000, we would be making a recommendation on entering some agreements on moving forward.
Very good. Very good. Thank you all for attending, and sake of time, we're going to keep moving. So appreciate your attendance here and the information you shared with us.
All right. Thank you.
Thanks.
Next on the list, we go from water quality to insurance stuff. I see the English team here. So we have a work session 12:45 with representatives from O'Connor and English to discuss insurance services and new valuations. Tim, if we can get you unmiked, we'll give you the floor unless there's any other staff, summary before we dive into this session.
Hi, this is Stella. Can everybody hear me?
Yes. Hi, Stella.
Good afternoon, everyone. I invited the O'Connor and English group today to do a presentation and overview of our insurance services. I've taken over risk management for the county when I came on board, and we work with O'Connor and English and through ICAP. And in the fall of last year, they looked at, requested new appraisals on our buildings. which we got back. So I thought this would be a great time to circle back just on our whole insurance program and discuss those and what the impact of those might be. So it's just a little update and what the purpose of this work session was.
Okay, can you hear me all right?
Very good. Yes, Tim, we can hear you.
Okay. First of all, thanks. With me today is Sue Miller from our office, kind of handles our office manager handles the day-to-day servicing of the county. And Cassie Kohler, I don't know if she's on the call yet or not, but she's from Bilbrey Insurance, which is a marketing arm for ICAP. That's who we have the county with. I'll go over just a summary quick of, or actually a brief history of ICAP. It started in 1987. Counties and municipalities had trouble securing insurance during the financial crisis of the 80s. So they changed Chapter 670 of the Iowa Code allows self-insured risk pools, which at that time we started Iowa Communities Assurance Pool, which is the name for ICAP. That's the acronym. It's been really successful. It's one of the top self-insured pools in the country. It's been 75 out of the 99 counties in Iowa are currently insured with ICAP, and it's endorsed by the Iowa State Association of Counties. It's very, very stable, financially sound. We write for other carriers that would look at the county, but they would not beat the pricing or the coverages of ICAP. And as you may or may not know, we have the fairgrounds with ICAP, also Sunnycrest, Dubuque County Library, and the workers' comp is with IMWCA, which is kind of an arm of ICAP. So that's kind of a background on our agency and ICAP, and you should have in your handouts, I think they have them, don't they, Stella?
Yes, I put everything in the packet that you guys sent over.
Okay, briefly, I'll just go over the coverages we have. It renews January 1st, goes to fiscal year January 1 through December 31st. The liability, we have $12 million limit on liability. That's for third-party general liability, auto liability, public officials liability, and law enforcement wrongful acts liability. So we'd have up to $12 million on a claim. If you go on that insurance proposal on page 3 there, you can see what the premium was this year, what it was in 2019, and we're just starting to work with Stella on getting the renewal information for January 1st of 2021. 3 main parts of your coverage: the property agreement, which you have in your packet, also the property agreement schedule of benefits. All the buildings totaled, we have a blanket limit of $65,883,229, and on contents or personal property, we have $8,668,417. Now, I'm not going to read all those other coverages they give you, but cyber liability and so forth, but a cyber breach, but it is, and we'll get to the blanket later. That's one of the things Stella talked about, but they reappraised all your buildings last year, and we'll get to that a little bit later, but that's in a nutshell the property. And you do have a $20,000 per claim deductible, which keeps the premium down. And on the liability portion, if you see the legal defense claim payment agreement, schedule of coverages, again, $12 million on auto liability, general liability. Up there, looks like Stella pulled it up. Public officials, wrongful acts, the supervisors who get sued because of a wrongful decision, you have coverage there, and ICAP will pay to represent you. And then also the legal liability on law enforcement claims. And if you bounce back to the insurance summary, Sunnycrest is insured, the property is insured with, correct me if I'm wrong, Sue, with ICAP, but we do have the liability and the professional with another carrier. That's correct.
And that's 1 million per claim with an additional 2 million over and above that on excess liability. So a total of $3 million per claim on the Sunnycrest Manor.
And excuse me, Supervisor McDonough, what page are we on, please?
On the insurance summary, page 5, I believe it is. 1, 3, 4.
I think it's 6 of 11, Tim.
6. Yeah, I'm sorry. Page 6 shows a professional general liability. On the top, it's got Hallmark Specialty Insurance Company. But that's Sunnycrest. That is it's a separate policy.
What page in the packet is it?
Yeah, it's not, none of this is actually lining up, I don't think, but all the same.
6 on the insurance proposal, the 2021.
It's in the neighborhood in the packet, but it's, so yeah, if we could present, if somebody could just present the information on screen, that would keep us all on the same page.
Yeah, it would.
I don't know, Stella, can you pull that up? There it is.
Thank you.
Yep. It shows 1 million per claim on professional general. And if you flip to the next page, page 7 is the excess liability on Sunnycrest, which is an additional 2 million. So we'd have a total of 3 million per claim with Sunnycrest. And there you can see the premiums and the optional if you wanted higher limits. And then if you want to flip again, Stella, is you have Sunnycrest has a trust fund, you need a bond, and that's written with Nationwide Mutual. And if you keep flipping, then we get into workers' comp, which is written with IMWCA. That's broken out into payroll classifications. They'll do an audit every year. Your claims have been coming up a little bit recently in the last year, but the 3 years prior, you've had good claims experience because you've got a 0.83 modification, which means you get 17% off the bureau rate on your workers' comp. And basically, that's in a nutshell the 3 biggest portions of your property liability, your workers' comp, 3 major areas of your coverage. And like I said, ICAP has a property and liability, and IMWCA, Iowa Municipalities Workers' Compensation Association, which works with ICAP, writes the workers' comp. Sue, do you have anything to add, or Casey?
I apologize. My electricity went out at the beginning of our discussion.
No.
So I didn't get the first part of what you commented. Did we touch on the bond at all, Tim?
Yes, we did on the trust fund.
Okay.
Yes.
Okay. All right. And how
Yeah,
about
I
the
know.
employees?
I don't know if Supervisor Baker's on the call. I didn't see his name, but I know Supervisor Wickham. We've been ahead of the board a couple times, but this is probably all new to Supervisor McDonough. And do you have any questions?
I do not. I have some insurance background myself, so we're good.
Oh, that's right. Yeah. Well, and one other thing I'd like to say, if you ever have questions, feel free to call our office individually or stop in. We'd be happy to explain anything. The last thing on our agenda is, and Sue, you might take over if Cassie's not on the call. ICAP did some valuations last fall on all the buildings, and we discovered we were probably underinsured with a lot of the major buildings. But Sue, maybe you can take over if Cassie is on the call.
This is Casey. I'm here.
Or Casey. Go ahead, Casey. Maybe you want to give them a little background on the valuation.
I'm happy to. Sue, is there anything you wanted to say before I jumped in?
Nope, go right ahead.
All right. Thank you. Again, my name is Casey Kaler, and I am the marketing representative for ICAP. I've been in this position since 2000, but I've been with ICAP a lot longer than that. So I've been around the block and glad to be here at this meeting, well, virtually anyway with you. I apologize you can't see me. My bandwidth is not good enough to have both voice and video right now, and we're still working from home. So I apologize you can't see me. I'm working on that to get better bandwidth. So the next time that you and I chat or we chat, you'll be able to see me too. Not that that's a great thing, but you'll still be able to see me. So we did appraisals for all of the ICAP membership. We started in 2014, and we did it because we identified that there was a significant difference between what our members felt adequate coverage for their, well, for some buildings in particular, county courthouses being one of them, significantly different in the amount that they thought they should be scheduled for and the amount that they really should be scheduled for. And a lot of that is really, you know, it's just when you think about putting back a courthouse in particular, you think about the cost associated with rebuilding the structure like it is now. And a lot of courthouses have, you know, artwork within it. They have a very ornate structure. Sometimes they have clock towers or stained glass, lots of ornateness. And when it comes down to it, it really, the community itself and how it feels about the courthouse or whatever building we're talking about has a difference in the way you insure it. Whether you insure that courthouse to be replaced with functional use, or should you want to replace it with Italian glass that is imported, those are conversations that are best had prior to a loss. And so that's really why we did this. In Dubuque County, we looked at 19 locations. I am very pleased to report to you that there was only one location that was not on the statement of values, and that is really a testament to the work that your agents do and that you do to make sure it's up to date. And that one was a wellhead. So, I mean, it wasn't something that really is a big deal, $31,000. I feel like we could have found coverage for that somewhere if we had a loss to it. I think more importantly, not more importantly than the fact that you guys did a good job, but more importantly than adding that, this appraisal identified significant value differences in a couple of your locations, courthouse being one, Veterans Affairs building being another, not E911, excuse me, and your jail were the big ticket items, if you will. Your courthouse went from 14 million to 27 million. The Veterans Affairs building went from 1.8 million to 5.4 million. And then your jail went from 8.2 million to 27.5 million. Those are very large increases sounding, but really it's not uncommon with what we're seeing. And I think Tim mentioned at the onset of his conversation, he did a great job of talking about the history of ICAP. And one of those things he mentioned was that, well, he talked about the value of it, and you have really seen it here because there was really no, I lost my train of thought, I apologize. I think my point was that you're not out of the norm for public entities. We have added $2 billion in new insured value, whether that is a new building that wasn't on the statement of values, or if it's new in value, like most of what you have situationally here. It's very important that those values are kept up to date. I know it sounds shocking when you look at the values, but it's certainly not abnormal, and it's really good that you caught it before instead of after a loss.
When is the last time, could I just interrupt you for a minute? When is the last time that our values were updated?
Your values are looked at on a regular basis. So every time, and I'm sure your agents do a lot of work that I'm not going to speak to. Our office, as far as ICAP goes, we run specific criteria or information about each one of your buildings through a valuation program. And that's done annually. And that takes a look at your square footage, year built, number of floors, construction code, fire protection class code, those types of things.
And did you do that last year? You did it last year?
Yes, ma'am.
Right.
Every year.
I don't understand the increase in the values over 1 year. I guess I need to have you explain that in some detail why the increase in values has occurred?
I'd be pleased to. The one thing that's lacking in insurance programs that do appraising, basically appraisal programs, is that they have limitations when they're dealing with buildings like courthouses, ornate historical buildings, wastewater, water. Those type of buildings are not adequately valued through these programs, and it's not common for insurance carriers to come in and do this kind of in-depth report. And your agent is not equipped to value these locations either. So we, until recently, until ICAP invested this money, we were depending on you as the entity to know what those more high dollar valued buildings are that we didn't have the ability to value ourselves. And that's why ICAP invested the money that it did to value those buildings that really didn't have a place to get valued unless it was on site with a true construction expert and appraiser.
So what did you hire to get the new values created?
Who did we hire?
Who, what, a new program? What did you do that made the new values?
Excellent question. We actually hired an organization out of Idaho, Valuations Northwest. They came in, they spent time in your community, several nights, in fact, in Dubuque, and Dubuque, the city of Dubuque is also a member and also received the service. So they spent several nights in your community and valued all of those locations. So it was more than just plugging values into a program and having it spit out. They actually took measurements of ceilings. They took measurements, obviously, of all of the building itself as far as square footage goes, and they documented each and every single location. And in your packets, if you don't have this, I think you do, in fact, I can't pull it up with myself for you, but it's the Valuations Northwest appraisal packet. And in that packet, you will see a 3 or 4 page document dedicated to each and every building that we looked at. And you're going to see information down to a very granular construction level so that you understand how we developed that appraisal. It could not be done virtually. This is something that really has to happen, and it has to be boots on the ground, and it really couldn't be done efficiently until recently and with the integration of technology.
Because it just wasn't something that could be done because of technology, or because it's just never been done before?
No, I would say technology is what's really caused the ability to be able to capture this information. For example, the tools that they use just to capture the square footage alone has changed drastically in the last couple of years. And for example, I mean, when I was a kid, now I can say that I don't feel like I'm that old, but I am. I'm getting to be middle-aged, but when I was younger, 20 years ago, I would use, or not even 20 years ago, 10 years ago, 5 years ago, I was actually using one of those walk wheels to measure buildings. Now I can get on Google Earth. I can actually have a tool in my hand, whether it's even my iPad, that can measure things a lot more and capture that information in a lot more efficient way. And in addition, our phones can capture latitude and longitude now, which gives us the ability to, even if we don't have a 911 address, we now have longitude and latitude, so we're able to respond to a loss a lot quicker because we know exactly where that building is, even though we don't have a 911 address. And that's important to count because you have a lot of buildings that are kind of out in the middle of nowhere and sometimes difficult to find, frankly.
So would it be likely that next year our values would increase this much as well?
Absolutely not. I would be surprised if you see, I mean, I would be shocked if you saw, first of all, we're not going to do this again for another couple of years. The ICAP board is currently in the process, because until recently, like I mentioned, this hasn't been really able to be done efficiently for the amount of members that we're talking about. We're talking about several $1 billion of total insured value. So it takes a long time. It's taken us 6 years to get to this point alone. So the ICAP board this year is reviewing programs and available options going forward so that values don't deteriorate, if you will, because some of the other benefits of doing this process for the ICAP membership as a whole is we've updated all of your information. You know, I mentioned construction code, fire protection class code, year built, number of floors, et cetera. All of those components are very important. If we don't have one of those components, we're guessing then, and we're calculating contribution on a guess. Well, now we have all of that data, which if you think about that in the masses, I'm kind of going beyond your question actually, but if you think about it for the masses, ICAP is in a great position to market itself to reinsurance carriers, which it does from time to time. Currently, Travelers is the reinsurance on the property. But when a reinsurer can look and go, wow, they've gone to a lot of work to really fill in all of the information about each and every property of value, and we know what we're getting into, and we're willing to give a better rate to them. And that's really particularly important right now because it's a difficult marketplace, and I'm afraid that between COVID, all the hurricanes, the derecho, it's going to get worse before it gets better as far as insurance as a whole goes. I'm not talking about ICAP, I'm talking about an industry now. But it would surprise me, in short, ma'am, to say if you wouldn't see these kind of increases again. We're going to run these. You're going to, and frankly, if you don't agree with these values, we'll go back to the drawing board. You tell us why. If you have a construction person in town that says, you know, we don't like these values, that we don't think that it's going to require, we will do it for X, Y, and Z. We'll just lower the value, keep it at replacement cost. But at the end of the day, those values are important to you because if you have a tornado go through town and it wipes out a lot of your buildings, it's a little bit more difficult with the county because you're so spread out, but it's entirely possible that you lose a lot of locations with a big thing, like especially like a derecho, when we can all really feel, I don't know, I'm sure that you guys felt a little bit of that over there, but that thing was intense and long sustained. So it's really easy to now imagine even a large swath of property getting damaged by a big windstorm. For example, one of the reasons that we—
Supervisor McDonough, do you have another question? Do you have any more questions,
No,
Supervisor McDonough?
I do not know.
Okay. Thank you. And I did notice that, appreciate the appraisal. I did notice that you did pick up some of our new buildings, the Farley shop, the West Campus office, and the West Campus shop are also located in that appraisal. So greatly appreciate that. In the sake of time, I want to keep moving. Stella and Tim, maybe you can circle back on the information you want the supervisors to know today.
Yeah, thanks, Supervisor Wickham. One thing, Ann, with your background in insurance, the good thing is these are all the properties written on a blanket basis. If, you know, in the past, when I bought the agency in 2012, Frank and I questioned whether the courthouse was written to replacement cost or not, but it really doesn't matter. You got the full amount on the blanket. You know, if we had it at 14.5 or whatever it was prior to that, and it was 21 to rebuild, they'd pay the 21 as long as that was the only building that was damaged. But again, I'd just like to thank Dubuque County for putting their trust in our agency. We think it's the best program out there for counties, as I mentioned earlier, and feel free to contact us anytime if you have questions regarding. And we did add that the new West Side building. I know Denise had sent a chat out there. Is that on the policy? And it is. So the policy should be updated. All new buildings, all new wells, whatnot. But that's pretty much all I have, Supervisor Wickham. Sue, do you have anything to add? Or?
Well, thank you, Tim. Stella,
Oh, I don't,
you
Tim.
have.
Just thank you to Tim for giving us an update. We're getting ready. I just actually got the paperwork today to start working on our renewal for January 1st. So I just thought this timing was good to just do a review before our next renewal.
I would agree. I think it makes sense, particularly with the substantial changes that we had in our valuations.
Yes.
All right, thank you. Greatly appreciate it. We'll keep moving on our agenda right now. And so I believe the next item on our agenda, we've already discussed the public hearing for the ATV. We are now in a work session to discuss the Dubuque County ordinance for Chapter 1 zoning changes. And so I'm not sure if this is the zoning department or possibly the auditor's department that's leading this.
Supervisor Wickham, I'm here.
I know that Denise is on as well. Or do you want me just to start going over this? This is a new one for us. We haven't done this before, so guide me on.
Well, maybe you could summarize what we're trying to accomplish, and we may table it to have the full board if it's that significant. I don't believe Supervisor Baker's able to rejoin us.
Okay.
So maybe in summary, what we're trying to accomplish here?
Sure. In what we're trying to do is, we started this project in February of 2016, and the Dubuque County Zoning Commission started the process of the zoning code update. The intent was to update the definitions and to update and have the rules align with the comprehensive plan for Dubuque County. The Zoning Commission held over 13 public hearings between February of 2016 to January of 2018 to address the proposed changes. The Zoning Commission did have the assistance of Dan Fox and ECIA in creating the format for the document that you see or have seen in front of you, the layout. The changes that you're seeing before you are all the ones that have been made and reviewed by the current zoning board members as well as some of the past members. They're all recommending these changes be implemented because they feel they're in the best interest of the public and in the county. They believe that the changes will not only make finding the zoning rules more user-friendly for the public, and they'll also serve the public and the county better. As you'll see, we've made these documents as easy as we can for you to read. We've color-coded them for blue for any new additions, and then the green is any ordinance changes in a new location, and then anything that's being deleted. So really what they did is, in a nutshell, they started with trying to see what was outdated, what verbiage was outdated. And so they've eliminated a lot of that. And when it comes to the user-friendly format, we started by putting in a description of the district to start. So if you pull up this and you see the C1, it'll give you an idea. This is what C1 allows. And so if I'm the lay person pulling up the ordinance, I can look at it. So that's kind of what this is about. So it's updating and
okay.
Go ahead, I'm sorry.
Okay, I see the document. And so one question before I ask a question of Supervisor McDonough. What is the timing of this? Is this something that has to be reviewed and completed today?
No, we've been working with Denise, the auditor, Denise Dolan, because of codification. So we've been working with her on that. Obviously, this does not have to be completed today. We are continuing.
Thank you very much. So a question for Supervisor McDonough. Supervisor McDonough, would you prefer to table this until we have the full board?
Well, we have this set to go out for public hearing, and we're going to have a public hearing next week. So to delay that, we'll have to pull it from Mary. You'll have to pull it from the publication. I have no idea.
I couldn't see the notice of public hearing, but we could handle that separately as well. I didn't see the notice of public hearing in. I see it on the agenda, but I don't see it on my packet unless somebody has the number.
It's on the very first page. It's the very first page of the zoning.
It would be on
okay, and then 311, I must have missed it.
Page 272.
Yeah, 272.
Okay, I must have went too fast then. Thank you.
So
Let me get to that
some
page.
of this has been, I think a lot of this was before us before, but I have no idea. I mean, I would assume Dave would want to be part of this. I don't know.
But all we're doing is setting that public hearing for the 28th. So we're not approving anything, is that correct? So we still could set the public hearing for the 28th.
I think.
So I'm asking.
What do you think, Tammy?
Well, the only thing that we're concerned about is if there's anything that you see that you have a concern on, these publications are very expensive. So if in the work session there's something that you wanted to change or wanted us to change, we'd rather do that during your work session before it gets to the public hearing because the publications are pretty expensive to republish.
I think we should move to table.
I will second that.
Yeah.
We have a motion and a second to table. Any further discussion? And I'm going to take this as a table to work session at this point. So all in favor, signify aye.
Aye.
Aye. Those opposed? Motion carries 2-0. Now let's take number F separately. So I wasn't sure exactly of your intent, Supervisor McDonough. Would you like to table the notice of public hearing as well?
Yes. Make a motion to table the notice of public hearing.
And I will second that. We have a motion and a second to table the public hearing for the Dubuque County Ordinance for Chapter 1 zoning changes. Any further discussion? All those in favor signify aye.
Aye.
Aye. Those opposed? Motion carries 2-0. Okay, thank you. Tammy and others are going to have to catch us back up, and we'll get the full board in front of this for this work session.
Hello?
Hi, this is Dawn. Mary and I are in the board chamber. So we have a deadline of Monday at 8 a.m. to send all of our notices to the newspaper. So by delaying this, we will have to publish this again. This was about a $5,000 posting for our newspaper. So I want you to be aware of that. By delaying holding the public hearing next week, we'll have to republish for another week. And Mary's unsure she'll be able to get them to pull the posting because we do have a deadline of 8 a.m. on Monday.
Mary needs to try to call both the Telegraph Herald and the Dyersville paper now and see if we can get this pulled.
Mary's going to do that right now, and we'll keep you updated. Thank you.
Okay, we've got a little work here to do, and so we'll revisit that item before we adjourn from today. But as of right now, it's tabled. Okay. If Dawn, can you bring the future resolutions up? The packet's pretty big in front of me here, and so
Page 311, Tricon.
We'll move to F. Thank you. All right, we have, moving on to G, we have a resolution approving the contract with Tricon General Construction of Dubuque for the courtroom first floor project. Do we have Chris Soderd on board or possibly somebody from FEH to talk through this quick?
This is Chris Soder. I'm here, Chair.
And Christy Monk from FEH is also here. Hello.
Wonderful. We've been through this. Maybe I'll just shoot it back to the supervisors. Any questions from Supervisor McDonough?
I did about the alternate heating system. I noticed that we have a letter from Shane Backenstead, which I appreciated very much. My comment would be that I would like to see from you, Chris, I would like a written report about the heating systems at the courthouse, when they were done, the whole thing in writing, so that we can see. We've got the note that came from Shane Backenstead is appalling in terms of the inability to use the system, the current system that we have throughout the courthouse. So I wouldn't want to oversight or lose sight of that. And that we need to have put the alternate bid in. Obviously we do, or we can't use it as a courtroom. Kind of debates, takes away the value of what we're trying to accomplish if we don't put in the right heating system. I don't know if you saw that, Supervisor Wickham. That
yeah, I did read it as well, and so yeah, it was long, and I can't say I'm a HVAC expert, but I generally, got his gist related to the temperature control settings.
Well, and that you can't really use it it's difficult to use it as a courtroom.
Yeah, it sounds like this is Christy Monk with FEH. Just based on his email comments, it sounded like it is usable as a courtroom. It's just not the most comfortable. So that is why we did request the alternate. I would like to just back up for a brief moment to let you know, supervisors, that I did speak to Tricon Construction and they were comfortable with their number. So that is why we are recommending them. They were the lowest responsible and responsive bidder. So our recommendation does include working with them on this, and they did have the alternate addressed, and they were also low on the alternate. Now, if the alternate is pursued, we do have an end of January 2021 substantial completion date that they were willing to commit to, simply because they're not sure how long the actual heat pump piece of equipment will take. So the completion would be of that component would be dependent on that piece of equipment, just so you're aware.
So the 137,500 does not include the alternative heat pump?
It does not, no.
Okay.
And that's an additional
And your
$30,000.
And your recommendation today, Chris Soder and Christy Monk, is to do what?
To move forward, this is Chris Soder speaking, to move forward with the alternate, include the alternate with the entire contract, then we don't have to backtrack down the road, and we can get everything done in a timely fashion.
Chris, are you sure that the alternate system you've selected is going to solve the numerous problems presented?
Yes, this is going to be a similar to your forced air furnace system at your house. It'll be a single unit that feeds through ceiling ducting to the entire area, capable of heating and or cooling the entire area with people in it. The goal is, and it also cuts down on all the noise. You know, the console noise behind your desk up, you know, at the at the board chambers and stuff, and this is going to eliminate all of that console noise.
So a couple thoughts right now. We got 1 minute. We got a resolution that says 137.5, and so can we change that resolution and have it back to us next week with the alternatives listed in the resolution? Because today it's not in the resolution.
Right, it's not.
Not saying that we couldn't modify it. We have done that in the past, but it'd be good to get the document correct. Is that a feasible solution, Christy, Chris?
I'm totally fine with that if it make everything move smoothly and get everything moving forward.
This is Stella. I just wanted to jump in to let you know our budget, what we have budgeted is $135,850.
Okay. So if we did go with the amendment, most likely, or with the new pump, we'd have to probably amend the budget for this as well.
Yes.
I will make a motion to table this resolution.
Second.
We have a motion and a second to table a resolution related to the courthouse project. Any further discussion? All those in favor signify aye.
Aye.
Aye. Those opposed? Motion carries 2-0. We'll table this till next week, and I think two things. One, maybe circle back with Stella on the budget, and two, present the resolution with the amendment, potentially with the additional add-on of the pump as well. So the math works.
Okay, thank you for your time.
Thank you very much. Greatly appreciate it. Okay, we're moving on to H, resolution approving the offer to buy real estate and acceptance agreement with William J. Dean Jr. and Amy L. Dean for the FEMA acquisition. And I'm familiar with this project, but maybe somebody can just speak about the resolution.
This is the one that predates me. Is this something that has to be done now? I don't know this. This is the long, complicated purchase that predates my involvement, I think.
This is Stella. I can jump in with a little information.
Please do.
This is a new purchase agreement. This has gone on for a little bit of time, but it's a FEMA flood buyout for the Dean's property. They had asked to retain about an acre, a little bit more than an acre of land. So we had to do some new surveying and platting to make that happen. So this is a purchase agreement that reflects the new purchase amount less those retained acres.
How does it compare to the original amount we were spending?
I believe it reduced it by, I want to say it was about 225,000, but I don't have the exact number in front of me. So I can pull up some information if you give me just 1 minute.
And is there a deadline on this?
We are moving toward closing, hopefully by the end of this month or getting close to that. So we would like to get this approved and keep it moving. CJ has reviewed this again as well.
And Stella, are you confident in the dollar amount, the $211,312.96?
I am. The total project cost was $254,500. That included the acquisition, which this is the acquisition piece, plus demolition and those other things that we have to do to the property to make it good for the FEMA flood program. So I am confident in that number of 211,000.
If we table it, is that going to push anything back?
I don't know if Mark Schneider is on the phone at all, but he is the one that's been communicating with the deans on the closing. So I don't know if he has a closing date set or not.
I don't see him listed, but
Yeah, I don't know anything about this deal. I think I've voted no in the past because I don't know the specifics. It's long, complicated, and not been, everyone just wants it over.
I believe that the deal first started maybe in 2018 or even prior to that. So it has been going on for a little bit of time, but we are nearing completion of getting the purchase completed.
Move to table.
I will second that. We have a motion, a second to table the resolution. Any further discussion? Those in favor signify aye.
Aye.
Aye. Those opposed? Motion carries to table 2-0. So we'll take another shot at it next week, and maybe any additional documents or possibly ECIA's involvement might assist the board here, but thank you. Okay, moving on to, it looks like I, resolution to approve the collective bargaining agreement with the Teamsters Local 120 representing the courthouse employees. Dawn Sherman, do you want to elaborate?
I would be happy to, thank you. So this is for our Teamsters that are in our courthouse bargaining unit. We did a one-year agreement with them. We had entered into negotiations pre-COVID, and then as we started to open up the building, access to the building, we resumed negotiations. So we agreed, and it does say a 3-year agreement, and that is incorrect on that resolution. It is just a one-year agreement for 2% GWI for FY21. And then with all of our bargaining units, we did add Martin Luther King Jr.'s birthday as a recognized holiday. So those are the significant changes. So this will be retroed back effective to July 1st of 2020, and we'll be resuming new negotiations with them here in the coming weeks ahead. So I recommend approval of this agreement.
But it's got incorrect data in it. Move to table.
I will second that. We have a motion and a second to table the resolution related to the collective bargaining agreement. Is there any further discussion? All those in favor signify by aye.
Aye.
Aye. Those opposed? Motion carries 2-0 to table. So it looks like we'll be back next week with this guy as well. And maybe we'll grab those numbers that need to be revised. Okay, looks like we have a resolution of appointment of deputies, assistants, and clerks. Dawn Sherman, once again.
Yep, you have in front of you 4 Sunnycrest positions. You have 3 full-time CNAs, which will really help with their staffing at this time. We are also hiring a PRN, RN. She was previously our nursing director and is going to come back and help as a temporary employee. So these, again, are just filling vacancies, so I recommend approval.
And all the information's correct then, right?
Yes.
Motion to approve the resolution.
And I will second that. We have a motion and a second to approve the resolution related to appointments of deputies, assistants, and clerks. Any further discussion? All those in favor signify by saying aye.
Aye.
Aye. Those opposed? Motion carries 2-0 to approve the resolution. Thank you. Okay, we have a resolution approving the letter of support for the Conservation Board application for the IDNR Water Trails Planning Assistance Program. And I'm looking at the resolution now. I don't recall this from the Conservation Board. Doesn't mean that I didn't get it, but I don't recall this specific resolution.
Supervisor Wickham?
Letter support. Yeah.
This is
Ed,
Ed.
please.
I was not at your Conservation Board meeting. I did prepare this information in collaboration with Brian Preston. It appears that the Conservation Board intends to apply for some planning dollars to the Iowa DNR to help create a water trails plan. This would be in conjunction with its comprehensive parks, trails, and open space plan that they are wrapping up. The request that they're making to the Board of Supervisors is to supply a letter of support for their application. That application is being prepared by conservation staff in collaboration with ECIA. There apparently is some value in having an approved water trails plan, in that it opens you up for some implementation dollars. This is not an implementation grant. This is a planning grant. And so they're asking for a letter of support.
Sounds pretty harmless.
Brian, I prepared a letter.
Supervisor McDonough, and he sounds pretty.
I would agree with you as well, Supervisor Wickham, as long as, let me just say, if there needed to be any matching funds or future funds committed to this, I would expect it to be in this letter. And based upon that, I would make a motion to approve.
And I will second that. So we have a motion and a second to approve the resolution for the letter of support for the Conservation Board. Is there any further discussion?
I would note that
all those in favor, go ahead.
Go ahead. To answer Supervisor McDonough, in my conversations, it does not appear that there's any matching funds required for this planning grant.
Thank you.
Thank you. Any further discussion? All right, all those in favor signify by saying aye.
Aye.
Aye. Those opposed? Motion carries 2-0. Thank you very much. Okay, we are on to our communications to receive and file. The first document is an opinion letter from County Attorney May regarding legal services invoice.
Motion to receive and file.
And I will second that. We have a motion and a second to receive and file. Any further discussion? All those in favor signify by saying aye.
Aye.
Aye. Those opposed? Motion carries, the communications receive and file carries 2-0. We have next a letter from the City of Piasta regarding urban renewal amendment. It looks like they're saying they have we have a motion to receive and file, and I will second that motion. We have a motion and a second. Any further discussion on the receive and file motion? All those in favor signify by saying aye.
Aye.
Aye. Those opposed? Motion carries 2-0 to receive and file. Next, we have a letter from the State of Iowa City Development Board regarding Piasta annexation. This one's a
motion to receive and file.
We have I will second that. We have a motion and a second to receive and file. Any further discussion? All those in favor signify by saying aye.
Aye.
Aye. Those opposed? Motion to receive and file carries 2-0. Next, we have a resignation from the Historical Preservation Commission. And I'm scrolling down to get that, unless it's on the screen. I don't think it is. All these things are long.
What's the proper motion for that?
I don't know.
This would be just to receive and file as well.
Okay.
I know I believe she moved.
From Vivian Taylor, is that correct?
Yeah.
Okay.
Motion to receive and file the resignation.
And I will second that. We have a motion to receive and file the resignation from Vivian Tyler, and hopefully to thank her for her services as well. And any further discussion? All those in favor signify by saying aye.
Aye.
Aye. Those opposed? Motion carries 2-0. All right, number N, we have a duplicate warrant for RDG for $4,900. Currently, somebody didn't get their check. And it's the proper motion to approve this? Mary or Dawn?
Yes, it is.
Make a motion to approve the reissuance of a lost check to RDG.
And I will second that. We have a motion and a second related to the duplicate warrant for $4,900 to RDG. Any further discussion? All those in favor signify by saying aye.
Aye.
Aye. Those opposed? Motion carries 2-0. Next, we have a resolution approving the flood control allocation to fire departments. It looks like we have City of Dubuque, Key West, and Sherrill.
Make a motion to approve the resolution.
And I will second that. We have a motion and a second to approve the resolution. Any further discussion? All those in favor signify by saying aye.
Aye.
Aye. Those opposed? Motion carries 2-0 for the resolution. At this time, before I jump to public comments, I'm going to ask if we have any clarity on the publication for the TH Cascade Pioneer Dyersville commercial related to the public hearing.
Yes, we do. Mary made contact with those organizations, and they are unable to pull it. It already went to print.
Okay, so the old classic line of hold the press did not work, huh?
Well, let's talk
Okay,
through that.
so
we spent the money, and so the question is, even if there's something in this that we want to discuss and we want to resubmit it, we're going to have to spend the money again. So it doesn't make sense to necessarily table it now because the money's been spent.
agreed, and really it's just a publication of the public hearing, and it doesn't necessarily mean, you know, the components of the content of the public hearing is that you're for or against those. So
correct. Yeah, but I think
would
it's
probably approve.
It's an extensive filing, is what I was told this morning. There's lots of attachments in any event. And I don't know then if it messes up their deadline for.
My vantage point right now would be to approve the notice of public hearing, and then we have the public hearing a week from now. I think that's the date.
Mr. Chair.
Yes. Denise Dolan, auditor.
You could have the work session you were going to have today as a work session next Monday, because your meeting and the public hearing aren't until 5:30. So you would have the opportunity to discuss and go over any concerns that you have in the work session that afternoon or earlier in the day prior to the meeting.
Good point.
I like that idea.
I would also comment that as you do these in the future, because there will be subsequent sections of the zoning ordinance coming before you. I think maybe one of the reasons this was rushed was so that you could have a public hearing at your 5:30 meeting when it is easy you would have concerns to attend. But I would urge you to consider putting 2 weeks between the notice and the time of the public hearing. If you were not at a point of meeting weekly, as you have been recently, normal modus operandi would have been for you to approve the notice last week and have the hearing next week. That then gives Mary time to send it once you have approved it, rather than trying to get it sent pending your approval, because there isn't time to send it after you approve it. So on some of these particularly large items, I think it would behoove people to slow down a little bit. There's no rush on doing this. And you know, give yourselves, the timeline you have to do is you can print no earlier or in shorter than 4 days before the hearing, no longer than 20 days before the hearing. So you have a window there you are comfortably in if you have 14 days between your hearings or between the notice and the hearing. And I just bring that up so that you possibly keep it in mind as you move along the road with some of these other zoning and subdivision ordinance postings, et cetera, that normally there's not a big rush and it would be much better cost-wise to give yourself more time.
I'll make a motion to approve the notice of public hearing.
And I will second that. We have a motion and a second to approve the notice of public hearing for the Dubuque County Ordinance Chapter 1 for the zoning changes. Any further discussion? All those in favor signify by saying aye.
Aye.
Aye. Those opposed? Motion carries for the approval of the public hearing 2-0. Thank you very much, and we'll keep in mind that 2-week time frame that Auditor Dolan was mentioning.
Right, but we should get it on for a work session next, the afternoon of the 28th.
Agreed. Dawn, can you handle that? Did you get that comment?
Absolutely. Yes, we will have one.
Thank you. All right. I believe at this time we're up into public comments. So at this time, anyone may address the board on matters of which there are of concern to that person and which are not on agenda items. Please go to the podium if you happen to be in the courthouse, state your name and home address. If you're not, please make recognition in Zoom as best you can. Please be aware that the board is limited in the ability to respond to such inquiries, and Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. We are in public comment, and so if my colleagues can help me and or unmute anyone who is from the public that potentially may speak. I do not see anyone at this point.
There's no one in the boardroom as well.
No one, thank you for that. Supervisor McDonough, do you see anyone from public comments at all?
No, I haven't been able to see anything for a while over here. I'm using a bunch of different screens. I don't have good internet today.
Okay. Yeah, we're down to 23 people, so it's
that's fine.
It's a shorter group.
Motion to adjourn.
Supervisor Rickham, can I
correct.
just confirm one thing? We, again, at our second meeting, regular meeting of the month, we've been holding the COVID work sessions at 6:15 or 6:30. I wanted to confirm we want to continue that for next week.
I would think so. Supervisor McDonough, any comment or thought?
I think we've been doing this as up to the chair, but that's what I think works best.
Okay.
Yeah, I'd say we just keep doing it. Keep the same.
Okay, thank you.
You're welcome. Okay, we have a motion to adjourn, and I will second that motion. So we have a motion and a second to adjourn. All in favor?
Aye.
Aye. Any opposed? Motion carries. We are adjourned till next week. Thank you all.
Thank you, everyone.